like to call to order this meeting of the Board of Commissioners of Ottawa County. The date is May 11. Presentation today is by Commissioner Holtvluwer. Please remain standing for the Pledge of Allegiance.
In prayer, please. Our Father, we come before you this noon. We ask for your mercies on all our decisions here today. We ask for your help and your strength in our decision making for our county and for the wisdom in our decisions. We especially ask for your continuing blessings on our police department personnel as they do for us and the job and off the job. We are thankful and very grateful for their services to and for us. We also ask for your protection for all of our county employees and all that they do for us and our citizens. Lastly, our Father, we ask for your protection for all of our county service personnel, wherever they are service. Be with us now, all that we ask. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hey, Justin, would you call the roll, please?
Yes, sir. Mr. Garcia.
Here.
Mr. Baumann. Mr. Zylstra.
Here.
Mr. Dannenberg.
Here.
Mr. Meppeling. Mr. Terpstra. Mr. Holtvluwer.
Present.
Mr. DeYoung.
Here.
Mr. Kyers.
Here.
And Mr. Bergman.
Here.
And Mr. Fensky.
Here.
Mr. Chair, we have a quorum.
Thank you. Next thing on the agenda is presentations of petitions and communications. Do you have any, Justin?
We do not, Mr. Chair.
All right. So the first thing that we have is a resolution that I'm going to read, a law enforcement resolution and recognition. Whereas in 1962, President John F. Kennedy signed a proclamation which designated May 13 as Peace Officers Memorial Day, and the week in which that date falls as National Police Memorial Week. Whereas there are approximately 900,000 law enforcement officials serving in communities across the United States, including the dedicated members of the Ottawa County Sheriff's Department, the public safety officers of the cities of Holland and Grand Haven, the police officers of the city of Zeeland and the Grand Valley State University, and the troopers of the Michigan State Police. Whereas 24 hours a day and 365 days a year, the local peace officers play an essential role in safeguarding the rights and freedoms of the citizens of our communities. Whereas it is important that all citizens know and understand the duties, responsibilities, hazards, and sacrifices of their local peace officers and support their mission of constantly safeguarding life and property by protecting the innocent against violence, abuse, disorder, fraud, and harassment. And whereas the Ottawa County Board of Commissioners and Sheriff Steve A. Kempker and Chiefs of Police and Public Safety wish to thank the local peace officers for their dedication, professionalism, and assistance when called upon, and honors their willingness to risk their safety, and this year particularly their health when serving. Now therefore, the Ottawa County Board of Commissioners hereby proclaims the week of May 9 through 15, 2021 as National Police Memorial Week in the County of Ottawa, and urges all citizens to publicly recognize the service of local police officers, peace officers in our community and communities across the nation. Dated May 11, 2021. So I have a couple of proclamations I'd like to pass out. I'll put my mask back on a minute. And I have one for Zealand. Who wants to take the Zealand one? And Brandon Valley. And you must be from the state police. I am. And Colin. And unfortunately, my own community isn't here, so I'll just have to deliver this one in person to Grand Haven. You're not here. So thank you, gentlemen. All right, I have another resolution in support of recognizing May as National Treatment Court Month. And I think we've got two gentlemen up. And, so I'm going to read this and then I'll give it to one or the other. In recognition of the outstanding contributions made to the well-being of Ottawa County community by the local judicial branch of government, specifically through the creation and long-time operation of the 58th District Sobriety Court Program, the 20th Circuit Recovery Court Program, and the 58th District Court Section 1090 Mental Health Treatment Court. The Ottawa County Board of Commissioners enthusiastically adopts the following resolution to declare May as Treatment Court Month. Whereas treatment courts have been restoring lives and families for more than 3 decades, and whereas there are now 4,000 treatment courts nationwide, including 199 Michigan treatment courts and 3 Ottawa County treatment courts, and whereas treatment courts are the cornerstone of justice reform sweeping the nation, and whereas treatment courts have served 1.5 million individuals, and whereas they are now recognized as the most successful justice system intervention in our nation's history. And whereas treatment courts significantly improve substance use disorder treatment outcomes and substantially reduce addiction and related crime. And whereas treatment courts improve education, employment, housing, and financial stability, promote family reunification, reduce foster care placements, and increase the rate of addicted mothers delivering babies who are fully drug-free. And whereas treatment courts facilitate community-wide partnerships bringing together public safety and public health professionals, and whereas treatment courts demonstrate that when one person rises out of substance use and crime, we all rise. Therefore, be it resolved that the Ottawa County Board of Commissioners declares that Treatment Court Month be established during the month of May. This was subscribed and sworn to me on the 11th day of May 2021 and signed by myself and Justin Roebuck, who hasn't really signed it yet. So I'll stop there and get his signature. And then we'll get him to sign it here a minute. I was serious when I said it wasn't signed. And then one of you gentlemen is going to say something.
Thank you very much. That would be the short version. But in all seriousness, we just wanted to thank the board for the support over the many years that we've operated recovery courts and treatment courts here in Ottawa County. We couldn't do it without your support. And as you know, all 3 of our chief judges, Judge Fine as our recovery court judge, as well as Chief Judge Van Allsburg and Chief Judge Canal, have supported these operations in the circuit and the district court for many, many years. And we've had several judges involved, and we've also had some great staff members. In fact, we have some of the staff members, including our drug court coordinator and case manager, Andy Brown and Emily Akhtaroff, who are online watching today. And there may be some from the 58th District Court treatment courts as well that are watching, but they and the whole treatment court teams that are involved in these are working tirelessly every day to try to make people's lives better, get them back on the road to recovery and become great members of our community. So thank you again for the support and for this recognition today.
And I just want to add that recently, like perhaps a week ago, we received notification that our SAMHSA grant request has been approved, which will provide us with adequate funding for at least a few more years. So we won't have to come kick your door down.
Okay, next thing on our agenda is our public health update, and Lisa has been patiently waiting while I read through all these resolutions, so thank you, Lisa. Oops, you gotta unmute.
Good afternoon.
There you
Hey,
go.
I think I'm going to let Darrell go first with our data update.
Hey, thank you, Lisa. Good afternoon, commissioners. I'm going to share my screen here a second. All right. Chairperson, would you kindly let me know that if you can see the screen?
Yes, yes.
All right, thank you. Okay. So I've had the privilege of presenting to the board a number of times through this pandemic. It's always a mixed bag about what I'm going to talk about. Sometimes it's tough news, sometimes it's really good news. And I'm just really pleased today to be able to come to you all to talk about improving trends, declining case rates, and just better news for our community. So in addition to just enjoying being here, I get to present some good information. So I'll just jump right in. Here in Ottawa County, we've had over 31,000 cases of COVID-19 since the beginning of the pandemic. You can see that there have been days where we have had well over 400 cases, which is a substantial amount of work for the people working here at the health department, Ottawa County employees, as well as our partners at the state level that help us with case investigations. The last time I presented to all of you, we were seeing 185 cases per day on average. And I'm just pleased to say that on average right now, we're seeing 84 cases per day. So a substantial reduction in the number of cases that we're seeing each day, just meaning that there's less work on follow-up for our cases that liberates time that we can focus on other activities such as vaccination, outreach, and support of other facilities and institutions in our community with public health information and education. When we look at the rates in Ottawa County, you can see that over time we've been in a decline since November and had a recent uptick through March and April. There are usually little bounces after holidays like Thanksgiving, Christmas, Easter, and spring break, but generally we tend to recover, especially if we're in a longer term downtrend. Through March and April, we had concerns that the variants of COVID-19 could impact our case rates in a negative way, meaning that it would make them shoot much higher than we have seen in the past. But after kind of experiencing a wave here in March and April, we're just pleased to see that the vaccine has also provided us with a lot of defense, and the variants haven't had the impact that they could have had. So in other places in the world, we see that COVID-19 is having a much broader impact, and some of that may be due to variants that they have in their respective countries. But here in Ottawa County, we're right now in an overall downtrend for our case rate, which is just fantastic for our community because some of the metrics for opening our community, which are right now hooked to vaccination rates, have caveats that are dependent on our case rates. So our case rates need to be below 250 per day per million in order to advance through different steps of reopening. And right now our case rate is 253 per day per million. So we're right at that benchmark and hopefully will continue to decline. When we look at our positivity, that's the proportion of tests that are coming back positive here in Ottawa County. We've declined since mid-April from about 20% down to about 14.6% today. This is another, something to celebrate. That 15% mark is an important measure or threshold for members in our institutions in our community like courts, who we just recognized. So just understanding that some of the other institutions in our community have reopening criteria or phasing that's dependent on different statistics. And one of them that is important is that 15% positivity that we see right here in purple. So we've declined below that, and hopefully we'll remain below that. That's just another something to be excited about and to celebrate, just to see the improvements in our community. When we look at the kind of zoom back, the bigger picture, looking at cases per week and the blue on top, hospitalizations per week in orange, and then deaths per week in the maroon or purple color. You can see this stair stepping down in our cases in the blue on top. Each week we've had fewer and fewer cases. Our hospitalizations are a little bit lower than we saw back in November and December, and they look like they may be decreasing, which is again something to celebrate. And then one thing I really want to point out is that the number of deaths that we've seen each week through this wave of the pandemic have been much, much lower than we saw in previous waves, and attribute a lot of that reduction into immunity that we have in the community, much of it induced by vaccination. So we can see that vaccination is having an impact. It's keeping people from passing away due to COVID-19. If we look back at previous waves of the pandemic, much of the conversation was around long-term care facilities and just the numerous and substantial number of deaths that we were seeing in those organizations. And I can say now that we've seen a substantial reduction in the older age group, and therefore also in our long-term care facilities. So just all things to be thankful for. And hopefully these trends continue in the weeks ahead, particularly as the weather improves, more people will be outside. It's just a natural way for people to socially distance. We've had a request from a community member just asking for a little bit more information on children and just a few statistics on people who are in the pediatric age group. Just wanted to put up an epidemiological curve, again, cases by week, just showing sort of wave in December, November and December of last year, the new year, and then the wave that we're experiencing right now. I just wanted to point out that we're still seeing a fair number of cases among children age 0 to 17. This is an age group that the majority of them are not eligible for vaccination. So the only immunity and protection they have is a structured environment where there's distancing and masking like schools provide. And then in addition to that, testing and rapid case detection. So just keeping in mind that this population is still affected by COVID-19, but we can see that the impact is less. So the total number of hospitalizations that we've seen in this age group is 10 over the course of the pandemic, and we haven't seen any deaths. But I do want to point out that there is a rare but serious side effect that could be associated with COVID-19. It's called multisystem inflammatory syndrome in children. We've had 5 cases here in Ottawa County. All of them were hospitalized for an average of 5.5 days. So there's still this sort of collateral damage of COVID-19, even among our younger folks, despite them having lower case rates overall. And we're also seeing that in those kids that are hospitalized, they don't necessarily have, many of them don't necessarily have those pre-existing conditions that we've become accustomed to associating with hospitalization and mortality among adults. So just kind of pointing out that kids are still affected, that they still do have these poor outcomes. They're rarer than their adult peers, but it's just something to keep in mind that we need to continue to mask distance in certain institutions in order to prevent the spread of COVID-19 and mitigate these poor outcomes. When we look at our hospital systems, there's a long-term uptrend in the number of beds that are being occupied overall for any kind of illness. And we're seeing a little bit different trend for the beds that are occupied by COVID-19 patients, with a slight downtrend maybe manifesting over the last few weeks. I don't know for sure. I need to check with our hospital partners if these general trends that we're seeing are part of just a seasonal trend, or if this could be due to something different. So stay tuned for more information on that. But I think the main takeaway is that the proportion of beds that are occupied by COVID-19 patients appears to be gradually decreasing since the middle of this recent wave. So again, seeing a decrease in hospitalizations due to COVID-19. When we look at our ICU beds, there's a general uptrend overall for any kind of illness or injury that puts you in an ICU bed, and then a lot of variability in the proportion of beds occupied by COVID patients. Generally, I'm waiting for a trend to manifest itself just because the number of beds that we have in Ottawa County is really small. So if there are a few new cases, those numbers can bounce up and down quite a bit. My hope is that this recent few days with the numbers going down ends up being the long-term downtrend. When we look at vaccinations in Ottawa County, just overall, this is data on those who have completed vaccinations. So either 1 dose of Johnson & Johnson or 2 doses of either Pfizer or Moderna. Here in Ottawa County, we've reached 45%, almost 46% of our entire population over the age of 16 that is completely vaccinated. You'll also notice that if you look at any dashboards or the state of Michigan, 55% of our population has initiated vaccination. And this is kind of a tipping point. Some of the things that other scientists have observed is that we just start to see case rates come down once we hit that sort of halfway mark, that 50% mark. So I'm hopeful that in addition to the weather and more people being outside, that also improved and increasing vaccination rates will also decrease our overall COVID numbers. When we look at that age group that's most affected by poor outcomes like hospitalization and death, those age 65 plus, we've reached our goal of 70%. So 73.3% of people in Ottawa County are completely vaccinated. We'd love to see that number continue to go higher, just because the more people that are vaccinated, the less transmission there is and the fewer poor outcomes there will be in this population. So vaccine is our way out of this. And I will continue to encourage everyone who's eligible to be vaccinated, even when we achieve these goals of 70%, because the more vaccinations, the fewer COVID cases we'll have. Here's just a snapshot. I know this is a very busy graph, but overall, it just shows that when we look at specific age groups, overall, we're generally seeing downtrends in all of our age groups. So here's kind of a legend right here in the middle. You can see 20 to 29 is this dashed brown line. And if you follow it over time, there was a time when people 20 to 29, carried the biggest burden of cases. And those numbers have continued to go down for that age group. And many of our younger age groups have been declining. And we still see that there is this relationship between vaccination and case rates. The less vaccinated, the higher your case rate, the more vaccinated, the lower the case rate. Just again, strongly suggesting that the vaccine is working in our community. So just encouraging news that in addition to all of our metrics going down, the vaccine appears to be working phenomenally well. So just the takeaways, we continue to see community spread, but transmission appears to be slowing. Case rates and positivity are decreasing. Hospital capacity remains adequate. But the proportion of beds occupied by COVID patients is higher than early this year, even though we're seeing some shimmering of hope that those beds that are occupied continue to go down. The age groups that are most affected are the younger age groups, 10 to 19, which I haven't displayed in this presentation, but it was followed then by 20 to 29-year-olds. Among those that are 65 plus, many of them are completely vaccinated. And I'm very, very proud of the public health department and our community for stepping up to take those measures to protect themselves and their community against COVID. So among everyone who's eligible for vaccination in Ottawa County, nearly 46 have completed vaccination. So we're quickly getting to that 50% mark. And those most highly vaccinated populations have some of the lowest COVID-19 rates, strongly suggesting that the vaccine is protecting people. And commissioners, that's it for me, and I'll pass it back to Lisa.
Thanks, Darrell. Lisa? Lisa, you have to unmute yourself.
I have a problem with that, I guess. Usually people try to mute me. A couple just updates for us. The FDA, we've been anticipating information coming out of FDA, but they recently, just this week, announced that the Pfizer vaccine has received emergency use authorization for adolescents aged 12 to 16. This is good news. It just allows a larger proportion of our population to be protected against COVID-19. There was a lot of rigorous and thorough review of all of the available data indicating that the vaccine is safe and very effective for this population. Soon there will be recommendations coming out. It's got to go through another committee, but these recommendations will be for use of the vaccine. After that comes out, it will be widely available through our organization and through our community health partners, including hospitals and pharmacies. So I just encourage everybody who's interested in that vaccine for their 12 to 16-year-olds, stay tuned and watch our bulletins for more information on where you can get that vaccine. Our department has completely transitioned from mass, meaning large vaccination clinics, to smaller pop-up clinics. This has been great. It's making it very easy and convenient for people to receive the vaccine where they live, work, and play. It lines very nicely with the mission of Ottawa County, and we're excited about being able to kind of scale things back and do things on a little bit closer and more personal scale. A great example of this was a collaboration that we did last week. I think I mentioned it a couple weeks ago at our board meeting, but we worked with the Centers for Disease Control, who came to Ottawa County during tulip time to provide COVID-19 testing for visitors and residents. What we did was we went alongside them and did some vaccinating in a little tent right next to their tent. And it was very, very well received. People were actually seeking us out when they learned about the opportunity for both testing and vaccine. We just ran it a couple afternoons. There were about 362 people that were tested, and we found 45 of those folks were tested positive, and 125 people received a COVID vaccine. Yesterday, it was acknowledged by the state of Michigan that we've reached the milestone of 55% of Michigan's population that is 16 and over that has received at least one dose of COVID-19 vaccine. I think Jerome mentioned we're about 53.8%, so almost 54%. We're slightly behind Michigan, so we've got a little catching up to do. But in accordance with the governor's plan, this will allow employees, when feasible, to return to in-person work within the next 14 days. This is not an official orders yet. MIOSHA is in the process of reviewing the emergency rules that they have in place and anticipates that changes will align with the state's return to normal plan very soon. So we can all be watching for that. Last Thursday, based on current conditions and an acknowledgement by MDHHS on their current definition of guidance, now in K-12, in the K-12 setting, Ottawa County and Kent County announced that we will not be issuing broad local epidemic orders regarding quarantine of school-aged children. It is still recommended for close contacts to quarantine, which is in alignment with MDHHS and CDC guidance, but at this time we will only require or mandate quarantine for close household contacts and in the event that a child is part of an outbreak in this population. Many schools have chosen to follow only what is required, and therefore the number of children quarantined will, from this point forward, be far less than we have seen throughout the year. We recognize and commend the difficult responsibility of our schools during this pandemic, and I just want to say we appreciate the amazing job that they've done to educate our kids and balance that with safeguarding them from COVID-19 exposure while in school. We've worked very closely with our school leaders throughout the pandemic to collect and analyze school data related to COVID. In most areas across the county, school-associated cases have remained relatively low, with the exception of some of the data that Jarrell presented. It's remained low mainly because of consistent mitigation efforts. Due to the declining COVID-19 community cases, hospitalizations, and fatality rates, combined with the availability of safe and effective vaccines, the requirement to quickly isolate sick children, quarantine household contacts, and those involved in an outbreak, and with continued vigilance with safety measures such as contact tracing, masking, distancing, and hand washing, children can remain safe while in school. For those in the community, if you haven't received a vaccine, please consider doing so. It is the best and safest way to protect yourself and help you get the things you've had to give up doing since the pandemic started. Identifying one thing that you really want the freedom to do and evaluate how important it is for you. For one of my colleagues who's a physician at Spectrum Health, it's attending a professional sports event. For me, it's being able to travel to the Netherlands this fall for my son's wedding. For another friend, it was being able to visit her aging mother who lives in a long-term care facility. I realize that there are still many questions that people have or hesitancy for some, and I respect that this is a personal choice. It's very responsible and good to ask questions and do your homework before having any medical treatment or before taking any medication, including a vaccine. I encourage people to seek information from credible sources. As much as we love our families, our neighbors, our friends, the entertaining Facebook posts that we receive, it is important to acknowledge that they may not all be educated and trained as scientists studying under rigorous conditions. They may not be the best source of COVID vaccine safety information, since without expert training, there's the possibility for misinterpretation. If you are uncertain, I encourage everybody to consult with your medical provider, spend time reviewing information that has been produced by trustworthy sources and highly qualified credentialed authors who are well respected by their peers. If something doesn't appear to match reality, do a bit more fact checking. In doing your research, I think you will find that these current FDA authorized vaccines are very safe and effective. With 53% of our residents having received their first dose, let's all continue to work together to get to a place where we can toss out our masks, get back to work in person, attend concerts and sports events, get our restaurants, bars, and event venues back to full capacity, attend weddings, travel freely, hug, shake hands, and visit our loved ones. Thank you. That's all I have for you today.
All right. Commissioners, any questions?
Question for you, Lisa, if I may. Last night, I had the opportunity to attend a school board meeting. The whole school board was masked up, probably 75, 80 people in the audience with 4 people in the audience out of 80 having a mask. So if you pulled your crystal ball out today, Lisa, what can we tell people? What kind of metrics do we need to make? What has to happen for these masks to go away? I mean, people were angry last night. People angry at their neighbors. People angry at their colleagues about masks. Okay, so what has to happen that we can get to a situation and tell people in Ottawa County that our mask situation is going away?
Yeah, this is a great question. And I'm sad about the amount of anger out there. I think I've said this many times. I understand that this has been a really tough situation for people. I think we're getting there, Commissioner DeYoung. With the data that Jarrell presented, I think you can see that our cases are dropping. That has such a large connection with the fact that people have been vaccinated and continue to do all those things like masking and hand washing and social distancing. The governor, what's come out of the governor's office is that for Michigan, they would like to see that we get to 70% vaccination rate before completely eliminating the use of masks. I asked the question when learning about that. You know, the question that I asked was, well, okay, what if all of our cases are down and things are going really well and we have very few hospitalizations and very few deaths? Would the state consider reducing that 70% to something less than that? And the answer that I heard was yes, that they are continually looking at current conditions in the state of Michigan and just want to make sure that there are provisions in place and mitigation strategies in place that protect the largest proportion of people. So I'm really hopeful. I'm very encouraged by the direction that we're taking. I'm encouraged that vaccine is going to start opening up to a larger proportion of the population. I know our kids have been hit really hard with, everything this year, missing out on things. It's been hard. But again, I think we're definitely heading in the right direction.
Thank you, Lisa.
Anyone else?
Yeah, Mr. Chair.
Yep. Go ahead.
Go ahead.
Doug, go ahead. Doug?
Yeah, I guess this question is for Darrell. Darrell, do we have any idea, on the number of residents who've been vaccinated over the last few months? I know you're talking about raids, but do you have kind of like, this week, kind of go back a little bit or not really?
Much of that information, like as far as like how many people are vaccinated over time, is available on the Michigan's COVID vaccine dashboard. I think that if you're talking about the trend overall, are we continuing to have the same sort of proportion or percent of people vaccinated every week? Things are slowing down a little bit. I think that there's still a lot of hope that we'll continue to meet the metrics that the governor has set, 55, and then in the 60s and the 70s, there's always lots of opportunity. And I think that there's a lot of people out there who would love to be vaccinated or are thinking about getting vaccinated. It's just that there hasn't been a convenient time to do so. So I'm hopeful that, that people will, that when the vaccine is available in a doctor's office or somewhere that's very easy to get to, that they'll get vaccinated. Does that answer your question?
Al, Mr. Dannenberg.
Either to Darrell or Lisa. Okay, if you got the coronavirus, say in the past, the last year and a half, do you have antibodies in your body then? And then wouldn't that benefit all of us, that they would be part of the herd immunity? Is my question making sense? But I mean, so if they added all the people that got it and didn't get a shot with the ones that got a shot, would we be close to 70% then? And would we have herd immunity? So.
You want to take that one, Darrell?
I can start.
Okay.
And that's a really good question. And we've had it before, which is essentially, can we add up the people that have been vaccinated with the people that have had COVID-19 and just sum that up and hope that, it gets to 70%. And once we meet that, then we can reopen. Some of the hard parts is that we just don't know how long immunity lasts after a natural infection. Right now, the best evidence we have is that it lasts about 90 days at least. And there may be residual protection after that. We don't know. And so out of an abundance of caution, we try to tie things back to things that we can also document. So there may be many infections out there for COVID-19 that aren't documented somewhere that we don't know about. So there's also whether or not the number of COVID infections, is an accurate number. But we do have infrastructure for counting vaccines, almost everyone to the vaccine. So from a counting standpoint, it also helps us with those metrics. And the last thing is that those who have been infected, if they, months or weeks after that infection resolves, get vaccinated, it can boost their immune system and lengthen the amount of time that they could have immunity against COVID-19. So if someone's had COVID-19 a year ago, the vaccine could still be a benefit to them and to all of us by improving the wall of immunity in our community.
Thank you.
You have a quick question. 20% of our population today decided, I'm going to go get my vaccine shot this afternoon. Are there enough vaccines out there to take care of that 70% that we're all hoping for, or are we still lacking in the vaccine?
I can answer that. We have plenty of vaccine. We have been told by the state of Michigan that there is enough to vaccinate up to the 70% level, if not more. We have currently in our department have a vaccine available. We also know that our pharmacy partners who are getting the federal allocation have vaccine available and on hand, so that you would be able to go, for example, to Meijer or Walgreens and receive a vaccine this afternoon if you wanted to do that.
Well, we're not lacking vaccine, no. We're lacking time or.
No, we are.
Okay.
We are not lacking.
Okay, and one other question. Are there any reports or data, from the state or from the CDC reporting what impact, whether it's stress or emotional impact, is having on folks having to wear a mask?
There's a lot of information on masking. I know there's a lot of misinformation on masking too. Are you talking about mental stress?
Yes. Have studies been
Yeah.
made or taken or studied or?
Sure. I don't know off the top of my head, but I would be happy to do a little investigation on that. If I can't find anything, I can always contact the check, which is MDHHS. It's how we ask them questions and see if they might have any information or data on that.
Lisa, when you get that information, would you make sure that you get it to Al so that he can get it to all of us? The answer?
Absolutely.
Okay. Anyone else? Roger. Yes.
Lisa, this is Greg again. I got a follow-up question if I can, and I hope it's not a repetitious question. So many people ask, commissioners, why don't you make these changes? Why aren't you creating policy or something? Why isn't the health department doing something to override what's coming out from Lansing? I tell people a lot, what's happening here in Ottawa County, that we're not adding anything on to us that's being mandated by the state. Can you concur that, so we're telling the right information, that all the masks, the quarantine, the mandates are coming from Lansing? They are not coming from Ottawa County Board of Commissioners or the Ottawa County Health Department?
Absolutely. I'm going to say two things related to that. The thing that I think I hear a lot of comments on is masking, and contact tracing is another one. Those are both embedded in MDHHS epidemic orders. And under the authority of the Michigan Public Health Code, the Michigan Department of Health and Human Services has the authority to issue orders, which are essentially laws. And therefore, as commissioners, as a health officer, as a citizen, we are responsible for following those epidemic orders. I do not have any authority whatsoever to change anything that is in any MDHHS epidemic order. I also know that there are things that are embedded in a few other statutes. One is about quarantining and masking and distancing in the work setting. And then there are also MIOSHA rules. MIOSHA has their own authority to mitigate rules, to promulgate rules, wrong word. And I have no authority whatsoever to change any of those either, nor do any of the board members. As far as some of the requirements, requirements have been, especially during a pandemic, what we consider to be standard operating procedures given to us by the state of Michigan. We are held by the Michigan Public Health Code to perform certain services. Communicable disease services is one of those services that we are required to provide. We receive money for that. We are in a contract with the state to do those services. And part of that requires us to follow a certain set of standards. We did ask the state, and this was one of the reasons why we were able to change some of the requirements regarding quarantine in schools, for clarification about whether or not the state was going to mandate those requirements. And they said that is up to the local health department from this point forward. And therefore, we went ahead and working closely with our schools and in looking at the data to ensure safety, we made some changes there. So where we can, we really try to go with the least restrictive measures. Where we can't, we just have to follow the laws.
Thank you.
Anyone else? If not, thank you, Lisa. Thank you,
Chairman?
Darrell. Yes,
Somebody in the backfield.
that's. Yeah, we'll get that in just a minute. Thanks, Lisa.
Thank you very much. Have a nice afternoon.
All right, the next thing on the agenda is public comment. This is one of two times that anyone in the public can comment. We ask that you come up to the podium, give us your name and address, and limit your time to 3 minutes. If you want to come up now, you can.
Hello, my name is Karen Devries. I live at 396 Fair Hill Court in Holland, Michigan, 49423. I was hoping Lisa was going to listen in on this aspect, so I hope she's still watching. I come as a parent of 2 high schoolers, and listening to all of this, I'm going to adjust what I'm going to say, so I'll try to keep to 3 minutes. The emotional and physical challenge of wearing a mask, not only all day, but for participating in high-level competition volleyball, is a price that is being paid by children and students throughout Ottawa County and in all of Michigan. I'm quite disappointed, Lisa, to hear that you don't know the statistics or understand the mental health of Ottawa County. This is a major problem, and as a parent of kids, it is terrifying to me that this has been overlooked for COVID-19. The statistics, as we well know, for our young people are not a high percentage of spreading COVID-19. And also the hospitalizations and death. I mean, the death rate is pretty much non-existent. Yes, people get sick. I do not deny that. However, the mental health is heavy over our students, and our mental health facilities, I'm sure, are very packed. I'm disappointed that there's no information on that. Collateral damage, she mentioned collateral damage. Yes, collateral damage of our kids losing so much of their life. We are going on the 3rd school year. If this mask mandate continues, we are going on the 3rd calendar year of suffocating our kids or telling them they can't have school, they can't go to graduation. I mean, enough is enough. She said that when they can, we will challenge what the health department says. Can you all step up and say enough is enough with these masks? How many times do these children have to look at their teacher and not know your face? These teachers don't even know what these kids look like. One of my children has Down syndrome. It terrifies me that he thinks this is normal. Mom, put the mask over your nose. Breaks my heart. So we hear follow the science. We hear, let's see, trustworthy, highly credentialed sources. I do have to ask, have you looked at other science besides what's been quoted here today? We have several people who are certified in, I gotta think of the word, hang on, mask, PPE, and OSHA mandates to understand everything that not even a doctor understands about masks. Do you have them in here? They need to come here, and you need to fight for these kids.
Thank you, ma'am. Your 3 minutes is expired.
Thank you.
Thanks, Karen. Anyone else? If not, is there anyone on?
Yes, sir. We do have a public comments on Zoom, and I'm going to go ahead and start with Dave. Dave, if you could just state your name and address for the public record. You have 3 minutes.
Yeah, before my time starts, is there a way that you can see me on the camera? I think it would be nice if you could see my face.
I don't believe so.
Okay, Dave Rhodey, 12482 60th Avenue, Allendale, Michigan. Okay, commissioners, you say we're in a state of emergency. When I have to wait 45 minutes at a full restaurant to get a seat, I don't necessarily consider this a state of emergency. I think that should be reconsidered. What is the measurement? When's it done? It was number of cases. Now it's level of vaccination. The goalpost keeps moving. Very frustrating. Okay, so there's a lot of things that don't make sense. I'm going to jump on high school sports. Winter sports were delayed. It didn't look like it would happen. Let them play. A large group took a stand. They demonstrated in Lansing. Happy to be part of that. Filed lawsuits. Went before the Lansing Oversight Committee. The governor and the director, they didn't win. Winter sports were allowed. Some would call it a win. Kids playing basketball with masks on. You can box out, but you can't shake their hand at the end of the game. Come on, this is silly. All right? Y'all gotta take a rational look at this. This ain't right. These are irrational decisions. Fast forward to spring sports. Governor, director, they had to give in on winter sports, so they put a big mandate in place. Mandatory weekly testing of spring athletes. Teachers, band students, choir students, coaches, physical therapists, healthcare workers, pharmacists, food service workers, none of them got to get tested weekly, but our kids do, our athletes do. I call that discrimination, and I call it bullying. It doesn't have a place in our schools. It doesn't have a place in our community. This smells a lot more like a power struggle than it does rational thinking. Are we going to cave into these things that don't make sense? Are we going to compromise instead of taking a strong stand? Come on, we're better than that. I bring this up to encourage independent thought and action. I'm tired of hearing, we can't do anything. This is the way Lansing wants it. Well, guess what? I think it's time we all speak up and we say what we feel. And I think a lot of us, if we really trust our conscience, we can tell after looking around and going through this for 12 months, I think we can tell what's right and what's wrong. That's all I have.
Thanks, Dave.
Thank you, sir.
There's someone else?
Next, we have Ronnie. And Ronnie, again, if you could just state your full name and address for the public record, and you have 3 minutes. You may.
Sorry. Can you hear me?
Oh, no problem.
Hello. Can you hear me now?
Yes. Yep, we hear you.
Okay. Sorry. My name is Ronnie Allen. I'm at 11024 Timberline in Allendale. And I have something prepared, but I wanted to mention, I didn't hear mentioned earlier, that probably the most effective piece of a kid's immunity is their natural immunity with their natural killer T cells, which is very strong in children. It drops with age. And I just didn't hear that there was a list of other things that were all manufactured things, but thank you for listening. I'm here to speak about the COVID school mandates. I'm a parent of 3 school-age kids. My oldest is a junior at Allendale High School and a top student. She attended all year in person. She chose not to do sports this year and avoided some of the roller coaster. But she was still quarantined and missed her first SAT date. I think it's generous to blame COVID for everything being discussed. The state, county, local officials have initiated, interpreted, and enforced policies that have been inconsistent and arbitrary. The rationale runs the gamut, ever-changing and conflicting recommendations from the CDC and the WHO. I don't believe that they've represented a holistic body of science. COVID hit us out of left field, but in hindsight, I think a lot of parents disagree with a lot of the state's unfounded mandates being allowed to control the local schools and the schools allowing it. As a nurse and mom, I have concerns about the effect on learning of the mitigation mandates. Our children need to have the basics in order to learn, but they also need freedom to express and be heard and to move and to hug and play and breathe freely. And while in the safe spaces of childhood, their developing brains need to see the faces of those around them to prepare for life. I could go on about where our freedoms come from and all the other things that we could probably go back and forth about COVID. We might find disagreement in a lot of these areas. But the one thing we can all agree on is that what's best for the kids has been backburnered for what's best for society. And that's reportedly best for society. In hindsight, so-called mitigation measures have been a lot of a waste of resources. The suicide and drug rates and the burden on the mental health system has just gone up this year in 18 months or whatever the time has been. Your hands are not tied yet. You as local leaders are elected for many reasons. But to interpret the orders through the prism of our Constitution and then support or resist them, that is currently at the forefront. It is a big responsibility in this moment, but it is your job to represent and protect the rights of your constituents. My youngest 2 kids homeschooled this year at a cost to myself I had hoped I would regret the decision, and I haven't. If there are others like me and the number of them grows, the schools are going to suffer. I hope this doesn't happen in Allendale and Ottawa County. Please advocate for our kids, their state leaders, and stop enabling the health department's enforcement of the overreaching, unfounded policies and mandates, including any
Your
potential
time is up.
vaccine
Thank you.
push back. Thank you.
Who's
Next, we
next?
have Alyssa. Alyssa, if you could unmute yourself and just state your name and address for the record, and you have 3 minutes.
Okay, can you hear me?
Yes.
Okay, my name's Alyssa Olsen. I live at 3113 Park North Drive in Jenison, 49428. I have 4 children in the Hudsonville School District. The required rapid antigen testing has put undue stress and anxiety on our student athletes, coaches, teachers, and administrators. Our students have answered COVID-19 screening questionnaires, taken their temperatures, kept 6 feet of distance when possible, and worn their masks. Mask wearing has been the hardest on our athletes during contact sports as they are physically exerting themselves and struggling to breathe through masks. When students are playing sports, they sweat. Sweat then builds up on their masks, creating a breeding ground for the bacteria present on them. My children wearing wet, sweaty masks is much more harmful to them than not wearing one at all. And there is no data that shows this is even safe for my children. I also have a son who has asthma and has a hard time breathing during exercise anyway without a mask. How is this more healthy for him? These rapid antigen tests are not FDA approved and by law cannot be mandated. These tests were meant only to be used in a certified lab with certified technicians, proper PPE, proper temperature controls, proper handling, and proper reading within 15 to 30 minutes or it's void. Michigan is allowing school employees to administer these tests with their only training being a YouTube video. And these test swabs are also sterilized using ethylene oxide, which is a toxic cancer-causing agent. Michigan is forcing parents who want their kids to be able to play sports to allow these tests to be done on a weekly basis. Michigan is targeting these students athletes, and it's wrong. The data out there does not show that student athletes are at any higher risk of spreading COVID-19 than other students. Athletes are the only group that are being forced to test. Dr. Anthony Fauci even said on a live interview on CNN that I don't need to take a test, I don't have symptoms. If the chief medical advisor of our nation feels this is unnecessary for himself, then why are we mandating our asymptomatic healthy athletes to be tested? It's just not consistent. Please look into this and help fight against this. The requirement of students to wear masks during this school day is also harmful to their mental and physical health. My 4 children say their masks hurt their ears, give them rashes, itch, give them headaches, make them feel lightheaded, and make their glasses fog up. As of recent, my 14-year-old son told me he is sick of not being able to see people smile. All this being said, mask use should be optional and left to parental discretion moving forward. Our numbers are going down. According to Michigan Revised School Code, we as parents have the natural fundamental right to determine and direct the care, teaching, and education of our children. On the COVID-19 hub for Ottawa County, there have been 0 deaths in kids ages 19 years of age and younger due to COVID-19. It's been 424 days since our kids' lives were turned upside down from this. Let's let our kids get back to their childhoods and back to feeling normal because the data supports that they can. We cannot let the solution be worse than the problem. I ask that as our elected commissioners, you please start speaking out on behalf of these concerns to those at the state level, since you are not allowed to change these mandates at the county level, it sounds like, but please speak out on our behalf. Thank you for the opportunity to share.
Thanks, Elisa. Anyone else?
And next, I believe we have Nicole. Nicole, again, if you could just unmute yourself, state your full name and address for the record. You have 3 minutes.
Okay, thanks. My name is Nicole Shake. My address is 4109 Beeline Road. Thank you for allowing me this time. Can you hear me okay?
Yes.
Okay. Many of the things that I would like to say have already been said, so I will focus on a few other things. I have 6 boys that attend school in Ottawa County. All of them are athletes, so my focus will be on athletics. I'd first like to acknowledge the recent contact tracing decision that Lisa mentioned, and we are relieved and elated with this recent decision. This is something that we as parents have been begging for since the beginning of the school year. The data that came out from Grand Haven High School recently was very telling, and every school should have been required to show this information. They did a statistical analysis of the kids that had put in contact tracing. It's disheartening that it took a lawsuit from a group of athletes' parents to shed the truth that contact tracing was never enforceable because it was not a legally acquired public health order. It should be noted that just last month, while basketball was finishing up, we were still doing entire team quarantines for 14 days. Even with quarantining the opposing teams, if they had someone test positive, even retroactive 48 hours, both teams were quarantined. And then now all of a sudden we have a lawsuit, and it sent our local health department scrambling to completely go away with contact tracing. So, you know, as a parent, it just appears that decisions are being made not necessarily for the health benefits of our children, but out of fear for legal action. And then we have heard so much about mental health. We see today, and I appreciate the numbers that were presented. I did request those, but yet we still haven't seen the mental health numbers presented as far as deaths and hospital admissions for mental health. Just in our small community, we've had athletes, a football player from Hamilton who's taken his life, a hockey player from Mona Shores, a swimmer, a recent grad from Holland Christian, a Zealand student, who have all taken their lives. And so in order to better to serve, I think, you know, it's already been mentioned here, the toll that it's taken on our children, and just analyzing these numbers. And like the last person that spoke, is our solution causing greater harm to our children? That needs to be addressed. I think lastly, I just wanted to mention too, the masks for the athletes. It's troubling to see these athletes running up and down the courts with these wet, sweaty, unsanitary masks on their face while they're trying to play. And it's just hard as a parent to see our kids doing this day after day, many of these kids, and what's really happening. Is that my time?
Thank you.
Okay, thanks.
And next, I believe we have Lene. Lene, if you could just state your full name for the record and your address, and you have 3 minutes.
Hi, can you hear me?
Yes.
Okay, Lene Monera, 6722 Pierce Street. Commissioners, I read with extreme interest the press release from last Friday. Lisa talked about it briefly. That press release indicated that the Michigan Department of Health and Human Services has actually advised the health departments that enforcement of the school quarantine guidelines must now be by local health department order. And thankfully, the local health departments, including Ottawa's, would not be issuing any orders requiring our schools to comply with the MDHHS quarantine guidelines. So after a year of our healthy school kids being contact traced and quarantined, excluded from in-person school, extracurricular activities, this was, of course, great news to hear, as some of the other parents touched on. My question, though, is what prompted this change? Did these changes that were supposedly advised by the MDHHS, did the change have anything to do with recent lawsuits in Michigan counties, which have resulted in orders? I think, for instance, of a Sheboygan County, Michigan case involving the Claremonts. In that Sheboygan case, the local health department acknowledged that the quarantine notices that schools sent out on its behalf were in fact only notices and, quote, had no force of law, end of quote. Again, the health department admitted the quarantine notices had no force of law. The court in the Sheboygan case ruled that the local health department had no legal authority to require the kids in that case to be quarantined. Instead, the court ruled that the local health department was legally required to obtain a court order, which it did not do. So, my question is, would the quarantine letters from the Ottawa Department of Public Health that the schools in Ottawa County had to send out, would they be similar to the quarantine notices involved in the Sheboygan case? I'm just going to read from one of the Ottawa County notices. It reads in part, quote, "Your child has been identified as a person who has been exposed to COVID-19. As a result, she is required to quarantine. This means no public activities. Your child must remain at home," end of quote. Commissioners, respectfully, I ask the following. First, does the court ruling in the Sheboygan case apply to the Ottawa County Health Department? If the answer is yes, does that mean that the Ottawa County Health Department had no legal authority to issue quarantine letters that schools have sent out since the beginning of the school year? And if the answer to that question is yes, commissioners, as the entity that oversees the Ottawa County Health Department, what steps are you going to take to ensure that our health department acts in accordance with the law in the future? Thank you.
Thanks, Lene.
Mr. Chair, we have 3 more public comments as of right now. So I'll go ahead and I believe Sylvia, you're next. If you could just unmute, state your first and last name for the record and your address, and you have 3 minutes.
Sylvia, you're muted.
There, can you hear me now?
Yes.
Okay. Hi, my name is Sylvia Rhodes. I live at 12482 60th Avenue in Allendale. As county commissioners, you have sworn to uphold the Constitution of the United States. Constitutional rights are not suspended in times of crisis. Ken Paxton, Attorney General of Texas, explains, the Due Process Clause of the 14th Amendment protects certain fundamental parental rights, including the right of parents to make medical decisions on behalf of their children. Much was unknown about COVID-19 when the first executive order noted there is currently no approved vaccine or antiviral treatment for this disease. We now have both, and we know much more. After nearly 200 executive orders were ruled unconstitutional, similar orders were issued through MDHHS, including masking children as young as 2 years old, coerced medical testing of student athletes, and quarantining healthy students without proper legal authority or due process, as evidenced by the recent retraction of student quarantines in our county. Full relief from orders in Michigan is now only possible through mass uptake of a rushed vaccine under emergency use authorization. As elected leaders have failed us, parents are learning constitutional rights must be restored through lawsuits. In Ottawa County, the average age of death from COVID is 79.5 years, while the average life expectancy in the United States is 78.7 years. Younger members of our county are vastly not at risk, with 0 deaths age 0 to 19 and a 99.5% recovery rate for residents through age 59. COVID-19 will continue to pose health risks to vulnerable demographics, as all viruses do. But civil liberties are not contingent on a virus, and removing freedoms from all is not sustainable. Orders throughout the pandemic have disallowed personal responsibility and eroded the constitutional rights of students and parents, resulting in undue burden, restrictions, and irreparable harm to student education and socio-emotional development. Youth have been deprived of positive activities and once-in-a-lifetime events. The risk of anxiety, depression, and death from suicide has increased and is a greater risk to our students than COVID-19, a mental health crisis which must be weighed. Our hospitals, now well-equipped, are not filled with youth with COVID-19. Instead, they are filled with youth on suicide watch. It is heartbreaking to hear the stories coming out of Allendale. We do not want masks on our children. We do not want our children coerced to be quarantined, tested, or treated. We want constitutional freedoms returned, which government had no right to take in the first place. We ask you to direct the health department, which you oversee, to no longer enforce mandates on our youth. Mandates which the health.
Next, we have JRDJ. And again, if you could just state your full name and address for the public record, you have 3 minutes.
Yeah, my name is James Young. I live at 3662 140th Avenue in Hamilton. I have 4 children that attended school in Ottawa County, and they're middle school age and younger. I just want to say that back when COVID started, we were told things that would open up when the curve was flattened. We're being told now that, and the evidence is there, that it is going down. We're on a downward spiral again. But we're told that things still will not be opened up. our goal is being changed. We won't be opened up until we have a certain percentage vaccinated. So who's to say that once we get to that 70%, that then it won't change to 90, whatever. At this point, I really have very little trust in what is going to happen when it's said it's going to be happening. I will say I am thrilled that the contact tracing and quarantining is done with my school-age children for the most part, unless obviously we become sick ourselves. I've had, like I said, I have 4 kids in school, and in the school year alone, they have been quarantined for over 140 days. 140 days for 4 children. I want to see masks on in school as well. The information has been showing that they have little effect. Most of the teachers are being quarantined or have been vaccinated, sorry. I have children that have headaches on a daily basis. I have kids that have missed out on sports. I have kids that are constantly worried about what is going to happen, who's going to yell at them, things that they shouldn't have to be worrying about. Not to mention, I go in a store and my 1.5-year-old I have people attacking me and bullying me to get a mask on him when he doesn't even quote unquote need to, because he's not quote unquote required to. So I just want to say enough is enough. I want freedom of choice. I want things open. I want life back to normal. Our kids deserve it. We deserve it. And I call you all to stand up for our rights, which you vow to do when you take a seat there.
Thanks, Jane.
Next, we have Stacy. Stacy, if you could unmute yourself and give your full name and address for the public record, you have 3 minutes.
Yes, are you able to hear me?
Yes.
Yes? Okay.
Yes.
Yes, my name is Stacy Langstrad. I live at 7297 Medina in Hudsonville. Just to reiterate what most of these parents say, I think we're all in agreement here that things have gotten out of control and that we feel our commissioners are not working for us, with us, but against us. And I feel that a big part of that is Doug Van Essen and your legal counsel. Our superintendent of Hudsonville Public School reached out to him when I sent the email from the Let Them Play group that student athletes no longer needed to be quarantined. And he replied with an absolute nasty email saying I was searching for victory from the jaws of defeat, were his exact words, all to come to find out that I was right, that this lawsuit indeed did go through and that student athletes do not need to be contact traced. And besides the fact that I've never spoken with that man, that he would have the audacity to send an email to that to our superintendent who's reaching out for support and help from him is absolutely unexcusable. And the fact that all of you commissioners, except for 2, condone him and think that he is capable and doing his job and is just a good attorney is absolutely inexcusable. And he needs to be fired and his contract ended immediately. Thank you.
Thanks, Stacy. Who's next?
And that is all we have currently, Mr. Chair.
Okay, thank you. Okay. Next thing on the agenda is approval of the agenda. Can I get a motion, please?
Or
Moved and supported. Comments or questions? Justin, would you call the roll, please? Be sure to say more than just yes into your microphone.
Sir Hires.
Yes.
Mr. Holtlower.
I vote yes.
Mr. Terpstra.
I vote yes.
Mr. Garcia.
Vote yes.
Mr. Zylstra.
I vote yes.
Mr. Fensky.
I vote yes.
Mr. Dannenberg.
Yes, I vote.
Mr.
I vote yes.
And Mr. Bergman.
I vote yes.
Passes.
Next thing under action, the report, consent resolutions. Mr. Fensky, please.
Thank you, Mr. Chair, I would like to make the motion to approve consent resolutions 1 through 8.
Is there a second for that? Support. Moved and supported. Comments or questions? Justin, would you call the roll, please?
Sir, Mr. Terpstra.
Yes.
Mr. Holtbluer,
I vote yes.
Mr. Zylstra,
I vote yes.
Mr. Kyers,
Vote yes.
Mr. DeYoung,
I vote yes.
Mr. Fensky,
I vote yes.
Mr. Dannenberg,
I vote yes.
Mr. Garcia,
Vote yes.
and Mr. Bergman.
I vote yes. Under public hearings, there are none. Under action items, from administration, landscape maintenance contract. Mr. Kyers, would you read that, please?
I can do that. Thank you, Mr. Chair. Motion is to approve and authorize the board chairperson and clerk register to sign a 2-year contract between Ottawa County and Landscape Design Service for landscaping maintenance service in the amount of $135,000 and $14.00.
Support. Moved and supported. Comments or questions? Call the roll, please.
Mr. Kyers,
Yes.
Mr. Holtbluer,
Yes. Vote yes.
Mr. Garcia,
Vote yes.
Mr. Dannenberg,
I vote yes.
Mr. DeYoung,
I vote yes.
Mr. Zylstra,
I vote yes.
Mr. Terpstra,
I vote yes.
Mr. Fensky,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Next thing under appointments, Mr. Garcia.
Yes, Mr. Chairman, I have 4 appointments, starting with the Agricultural Preservation Board appointment. I place into nomination the name of Lori Larson and to fill township government vacancy beginning immediately and ending December 31st, 2022.
Support.
Been moved and supported. Comments or questions? I'm wondering if we could make these all one vote. Can we do that?
I believe so. I know you can
They're
approve
all,
them by voice
they're all
vote.
one person, right?
Yep. There are 4 appointments for 4 seats.
Oh, why don't you read all the motions?
Okay,
Would you
also, okay. Also for the Ottawa County Economic Development Corporation Brownfield Redevelopment Authority appointments, I'd like to place the nomination of James Bleicher and to select to fill the director vacancy beginning immediately and ending December 31st, 2025. And then we do have also 2 appointments for 2 slots for the Solid Waste Planning Committee. I'd like to place into nomination the name of Dan Boersma to select or to fill the role of city government vacancy beginning immediately and ending December 31st, 2022. And also to place into nomination the name of Kaylee Swanson to fill the industrial waste generator vacancy beginning immediately and ending December 31st, 2022.
And then a second for that?
I will support all
All right.
4.
All right. So, and you're saying we could do a voice vote on this? Okay.
Yes,
All
sir.
right. All in favor, say aye.
Aye.
Aye. Opposed, same sign. That passes. Thank you. Under discussion items, the first thing we have is Mr. Roebuck is going to give us his update and annual report.
Just 3 minutes.
Give us your name and address, please.
Well, for most of 2020, my address was 12220 Fillmore Street. Commissioners, for your time, and you do recognize we've got a lot of reports on the agenda today, so you know where to find me for sure. If you have any questions at all, but I think I'll kind of try to move through this quickly to respect your time as well as my colleagues too. This is my 7th annual report in front of this board. I can't believe it's been that many, and 2020 was certainly a very challenging year for all of us, but that's not an exception in the clerk register's office either. I will just say thank you so much to the many county departments that we work very closely with a few county departments all the time, our courts, this board, but we obviously have depended so heavily on many county IT departments, many county departments. IT obviously comes to mind for sure, but there are a number of others as well. So we just thank them for their work with us in getting through this year. For us, I think getting through this year depended heavily on the mission and the vision and the values that we have. And I do just want to spend a second to highlight this because I give credit to our incredible team for the resilience that they've shown this year and for their efforts to not just maintain our customer service standards, but to really think outside of the box in a number of different ways, to go above and beyond. And our mission is simple. It's to help people. And I don't think a mission needs to be complicated. Helping people and encouraging their trust in government is what we do. And then our values, very, very critical to the operation. And I think we can just see this in a number of different ways as it plays out here in this little snapshot of the annual report, but in a number of ways as we've kind of moved through the 2020 challenges. Just a quick snapshot of our organizational chart. You can kind of see how our office is divided up. I could not do what I do without really any of these folks. I have a recurring nightmare that I'm the only person that shows up to work. And the phone is ringing and emails and things like that. That it's fortunately never happened. Thanks in large part to Sherry Sales, to Rachel Sanchez, and the teams that they lead, which are definitely a huge value. We had a number of initiatives that we focused on in 2020, and some of those did, unfortunately get delayed just due to the unprecedented other things that we were doing. We essentially streamlined our vital records and register of deeds process this year by using a new software called Apex. We're one of the few departments in the state that is cross-trained between the register of deeds and the county clerk's office. And this is a great software system that basically integrates those two functions of our staff, and that's really moved forward well. Our Honor Rewards Expo, we'll talk a little bit more about that in a minute, but that was basically scheduled for 2020 and did not happen in person. Another main goal that we had last year was our office study. Essentially just kind of seeing how our teams operate and where we can make adjustments and improvements in the team's efficiencies. And again, we found out that we were incredibly efficient at picking up and working from home and being resilient to different working styles. Social media was a big push this year, as well as we expanded our social media efforts in light of the 2020 presidential election, which obviously occupied a whole lot of time for our staff. This is just a little bit of a timeline as far as kind of how we operated as an office. March 10, which was incidentally the night of the presidential primary here in Michigan. That was our first election of the year. About 10 o'clock that evening, the governor declared a state of emergency, as we all know. Changed a whole lot for our teams as we kind of move forward, essentially picking up our desks and moving to working from home. Again, could not have done so much of this without the support of IT staff, without the support of administration throughout the entire process. But we were able to accomplish remarkably a lot of things, even being completely and fully at home. Currently, our position is we're essentially about half back in the office with the vitals and deeds functions and half at home. We have a lot of digital work, database work, indexing, and all of that, fortunately, has not only been able to be done from home, but we've got data now on proving that it's been done more efficiently from home, which is kind of an interesting and exciting set of numbers. I think that's good. On the vital records side, just kind of going through a couple of quick numbers here. As you can see, we have some real differences in terms of how things functioned last year because of the pandemic. Marriage licenses, because of the process for marriage licenses, we've basically moved that process to a by mail process. Normally, the application can be online, but the application, the actual license itself is executed in person because of the requirements to the signature. So we've moved a little bit, and this is kind of one of the ways that we've thought outside of the box. Early on in the pandemic, I received a number of calls from some very frustrated and upset individuals. And currently, and the current place we were at, marriage was not considered one of the essential services. So we had sort of shut down appointments for those. And it really didn't take that many calls for me to realize, probably should have realized it earlier, because it certainly is for me. Marriage is very essential. And so we, got together with our team, put our heads together and figured out a way that we could do this by mail, using the online and by mail options, and essentially requiring people to get a notarization instead of our signature for those documents. So we move forward with that significantly. Business registrations, all copies, essentially, those things can be provided for by mail as well as online. And so a lot of our services were able to be offered in that way. Our birth records were just a little over 7% decrease from last year, from the 2019 cycle. And again, kind of on par with where we have tracked over the past 10 years, but a little bit lower than 2019. Deaths, unfortunately, as we don't have to discuss in too much detail here, were higher significantly. And certainly, seeing the actual impacts of COVID coming in on our death records is a sobering thing. Notary public applications and business registrations, there are the numbers there, 620 notary public applications. That's a little over where we have been in the past couple of years. And those actually are required to be in-person appointments with our office. We can't do those remotely at all. So those were all in-person appointments. This is an interesting chart, just a little bit on our concealed pistol license process. So we're about 2,000 over our normal numbers, a little over 5,000 CPLs issued in 2020, which is the highest we've seen. And it's an interesting trend. You can see that we're probably on average for the first couple of months of the year. Again, when we were shut down, this was not a service that the Michigan State Police was offering. Essentially, it's dependent on MSP backgrounds to issue a CPL. And then when we get into later June and July, you can see those numbers trending upward all the way until after the election. And these again are a large number of those are in-person appointments with our staff as well. Renewals can be done online. And as you can see here, we had a huge number of folks take advantage of that online renewal process. So over 3,000 were renewals, but over 2,000 were brand new applicants. It's a very busy year for our CPL division. Just want to touch base a little bit on honor awards. Despite the pandemic, we have been moving forward on a number of fronts here. We began a newsletter to our veteran email list, and that's expanded as 2020 moved forward. We're really excited about being able to connect with our veterans more and more. The number of businesses is also growing significantly. We have over 288 businesses currently registered that basically offer discounts and services to our veterans. And as I had mentioned earlier, our Honor Rewards Expo was scheduled for the weekend after Memorial Day last year in Grand Haven. And unfortunately, obviously, due to the circumstances, that was canceled. But we succeeded in that in raising over $10,000 from sponsors and businesses that wanted to participate and help in that. Really an incredible outpouring of support in that area, and we're really honored to have that support. We're also very excited that we're going virtual this year, June 5. So just really in a couple of weeks, we're gonna conduct the expo virtually. We've gotten some great video footage of some of our veteran partners, businesses and service organizations that are going to kind of highlight that. We're going to have a live panel of experts, some from Ottawa County here, some from GVSU and the Michigan Department of Veterans Affairs, to answer questions in a live virtual format for our veterans. So we're very excited about that. June 5, and we'll be sharing some more information with you directly on that as well. This slide just kind of goes through trends over time, and you can see, I guess just the one thing to point out here, obviously the deaths are significantly higher than they have been over the past couple of years in this 3-year time span, as well as CPLs. Another very busy year for our Register of Deeds division as well. So these are the funds that we received Outside of the state transfer tax, all of the other funds there have been receipted into the general fund of the county. A very busy year for our team. And again, we were able to do so much because of our ability to go remote and go online. So that's very exciting news. Our free online search, this was the biggest year we've ever had for our online index, which is a free index, but then people can have the opportunity to obviously purchase their property records. So we brought in a little over $40,000 just with that feature alone. And another very, very big year for document recording, almost 60,000 total documents. Were over 10,000 over what we were last year, but also a huge increase in the electronic recording of documents as well. Passports, another one of those interesting graphs where you really see the effect of the pandemic year on passports. This was for sure a small turnout of passport applications for many months in 2020. And hopefully as things pick back up, we're gonna obviously continue to schedule those appointments for the community. We had a number of plats, 13 total plats in 2020. So building and development, as I'm sure you'll hear Mr. Bush tell you later, it has not slowed down at all in Ottawa County. And so that's kind of where these plats are coming from, or at least where they came from in 2020 in terms of the approvals. And again, just some of those figures over time. A big year for the Register of Deeds office. I think a lot of things combining with that, you know, the low interest rates, the stimulus, and the fact that people have been home a lot, decided to do some home projects, refinance their homes, sell their homes. And so it's been a very busy year for our staff on that front. In circuit court records, we also see the impact of the pandemic here. We are essentially almost 36% down in terms of funds collected. And I know Kevin shared a little bit more in detail with you on some of the factors that go into that, but obviously the collection clerks having an impact there in terms of the number of hearings that they were able to hold, juvenile court, bed rentals, and just the lower overall court cases affected that pretty drastically. Our cases filed were pretty much on par, although the number of documents filed are a little bit lower than average as well. Obviously, domestic cases taking a lot of those. Personal protection orders were also pretty much on par with where they have been in previous years. We've obviously been open for emergency appointments the entire time to the community through the various phases of court operation. Our staff has been there to take appointments. Obviously, fewer juror trials, as you heard from Kevin and Judge Van Allsburg last week. Again, a lot of those scheduled on the dockets and waiting to get taken care of, hopefully, as we move into the lower phases of our operation. Lower adoptions as well. I think it's just affected the entire operation of the court. And again, there you can see some of those trending numbers. Happy to go over any of this in detail with you. Elections, very busy year for the team in terms of our elections process. Just kind of a breakdown of where we were for each election. We had held four elections, each with their own unique challenges in 2020. Very, very substantial turnout in November, obviously, with 78% turnout. May was also a unique election. We had 27% turnout, which is very high for a May election in 2020. That essentially was almost a completely vote by mail election. It was held under an executive order. The first and hopefully the last election we'll have to have in Michigan, held under an executive order. But it was successful. We definitely had a successful turnout. And this shows the absentee process, as we've talked about before. Proposal 3 in 2018 changed a lot of how voters participate because it opened up the process for no reason absentee voting. And we really see people wanting to take part in that process. I think both for convenience and obviously in 2020, this was a concern for a lot of voters to go out to the polls. So again, very strong turnout of absentee numbers. In November, nearly 60% of our voters participated by mail. And I just have to commend every one of our local city and township clerks. I would definitely be remiss for not highlighting the incredible work that they're doing. We were completely and fully reported, every one of those ballots reported in on our website by about 5 in the morning on Wednesday. We had a number of, over 1,200 election workers in Ottawa County doing a lot of hard work to get that process taken care of. Same-day voter registration, another thing that changed with Proposal 3. So very interesting numbers here. These are people who are able to register or change their address if their record is not accurate with the voter rolls on Election Day. And this is a secure process. It's done in our local clerk's offices. It's verified against Michigan's qualified voter file in real time. And so I'm a big proponent of the way that Michigan has chosen to do same-day voter registration, and obviously a lot of our Ottawa County voters are participating in that process as well. I think we had an extraordinary year for our team, and I want to just give credit for a second really to the whole team, but particularly to Steve Deitch, who is our elections coordinator. I know that you guys work closely with Steve, as have I over the past 7 years. Steve just recently accepted a position with the Election Assistance Commission, which is a federal commission that is based in Washington, D.C. He's going to be working remotely, but he's going to be doing some really exciting stuff there for them. They've basically created a position where the EAC will be helping local, municipal, county, and state governments across the country communicate with their voters. And Steve has done an excellent job with that during his time here. And so among the many things that Steve did this year, election worker recruitment was a major challenge in 2020. Looking at the at-risk population for COVID, particularly as we geared up for our first couple of elections that year, it was a huge challenge. We recruited over 200 new workers, which is really, just a little under 20% of our overall worker population in Ottawa County. And this is really a responsibility that the local clerks have to hire, but we felt we could partner with them in some really practical ways and basically hosted a training website platform at the county level. And that really kind of rolled right into the training process. So people could get recruited, sign up, take an online training, and be ready to go and fill in for election workers, which is really important. Online training was something that we did not do previous to 2020. We were 100% in person with our training, almost 1,200 total workers in a 2-year cycle that we trained in person. So we went from that level to about 90% online. And it was just an incredible movement. It actually was very successful. We had really positive feedback from the local clerks on that as well. We purchased extra equipment in preparation for those absentee numbers, realizing that it was a real need that we had. And again, allowed us to be very successful on election night. We also took the step of mailing absentee ballot applications. And again, really grateful for the support of administration, of the county board, of Doug Van Essen on this. We realized that the state would be doing this process. We realized that we could do it better locally. This was in concert with every single one of our local city and township clerks. And we were able to not only conduct a successful mailing of over 190,000 pieces of mail, but that allowed us to clean our lists both prior to the mailing and after the mailing. And so it made our voter rolls more efficient, and it made the process of issuing absentee ballots much more efficient for our local clerks as well. On the social media front, almost 1 million impressions on Facebook, a little over 120,000 on Twitter. So this was really an effort that we recognized we needed to take. There's some real misinformation and disinformation out there on social media, and we made a strong effort to communicate firsthand with our voters. So we're really proud of the social media efforts. I have to give a shout out to Katie Sims on our team for all of her work on that. She really is the brains of our social media operation. And we are very grateful for all the communication, Katie, that we've been allowed to do because of your work. I wanted to include this in here, and I know we're short on time, and so I want to hurry through this, but the Center for Tech and Civic Life grant is a grant that we accepted funds for, a little over $30,000. This is a little controversial, as some of you may have been aware of. There's currently legislation in Lansing that would prohibit election offices from taking funds in this manner, so private funds. And we wanted to be very clear and transparent with how we spent these funds. Obviously, these all went through the approval process, just like any other expenditure would in our office. But I also think it's important to kind of highlight the ways that we're able to communicate with our voters specifically using this money. And again, we received the grant and really wanted to emphasize the importance of good, solid voter education. And I think that was a very successful effort as well. Just a few of the numbers there. Again, in partnership also with Planning and Performance Improvement, Paul Sachs and Rich Lakeberg with Planning and Performance Improvement were a huge help in this effort in making our materials look good and making them, making sure that we're getting out to as many people as possible. So the Ottawa Votes campaign just won this spring an award from the Election Assistance Commission in outstanding innovation in election and cybersecurity and technology. So very proud of the team and all the hard work that they've done and the ability that we had to put those funds to use. Another really key factor was the Securing the Vote website. Again, this site is just, it's up live, it's there now. It's a continued tool that we use to really communicate with our voters. What are the real questions that you have on election security and how can we best answer them? So I encourage you guys to check that out. It's just miottawa.org/securing the vote. Partnership with IT and GIS in finding my Dropbox. So finding your Dropbox locations. That was a great feature that a lot of voters took advantage of this year. Again, a lot of new voters participating this way. And so that was a really successful thing as well. Some pretty big numbers there to compare to in terms of the number of registered voters has increased dramatically, as well as obviously the absentee turnout. Just a couple of things we're looking at in 2021 as we move toward, thinking again about how we can think outside the box and make sure that we are serving our customers well. We've begun fingerprinting for the CPL process, which is kind of a relief for the sheriff's office, who does a lot of other fingerprinting in the county as well. So we've kind of taken that on. Electronic return of land record documents is going to save thousands of dollars in postage. Again, working through the case management system process with a number of other county departments to move forward in that, and hopefully by the end of the year have a new case management system. And our offsite record storage, which is an ongoing project that we're very excited about. We've moved to the city archives of the city of Grand Rapids, kind of a joint archives with Kent County and the city of Grand Rapids. And we're just looking to streamline those records and make sure that we've got everything digitized so that we can remove records and save on storage cost. I think I went over my 3 minutes. I'm happy to answer questions, but I understand if you don't have any.
I have one.
Yep.
Justin, I know you don't have any control over this, but you could improve on this. We only gained 45 people in Ottawa County. If we're the fastest growing county, we're at warp speed or not yet with that, because we had 2183 deaths.
Yeah.
And 2228 births. So there's a bunch of people that got to step up, and we got to move on this. Is that
it's moving right along? Yes.
That is abnormal, though. Yeah.
I'm looking at your May 5th special election of last year, where 99% of the votes were absentee because of what executive order. What were the percentage for this past week, last week? And I know that you'll report on that next year, but I'll forget to ask the question.
That's a great question. I don't know if you have the actual numbers. I know that a couple of jurisdictions were over 80%.
What absentee?
Absentee. So we
Okay.
had a really light turnout in the precincts, but we did have a higher than average
Okay.
turnout overall.
Well, so my follow-up question is, I know that there are several House and State Senate bills regarding the election security. Would any of those bills hinder people from voting in the future absentee, but that would discourage them from continuing, the practice?
Thanks for that, Commissioner. Yeah, the short answer to that is yes. There's a number of bills. The Senate dropped a 39 bill package a few months ago. A number of them include some good things, some positive security measures, but a number of them are also really concerning to the clerk community in terms of what they would require and the inequity, I guess, that it would present, because they're proposing a lot of changes without offering funding, which essentially means that communities can afford it will have greater access to drop boxes and absentee voting, and others may not. So as you may know, I'm the co-chair of the Michigan Association of County Clerks Legislative Group. We're working toward some resolution with a lot of those issues with the legislature, but definitely concerning on a couple of those fronts.
Both myself and Commissioner Zalster had the opportunity to listen to Justin. He presented before the MAC Finance and General Policy Committee on Friday, and after you bust out or zoomed out, Commissioner Zalster and I continued the conversation on what can we do to ensure that every voter who wants to vote and is eligible to vote can vote, and not put any roadblocks in front of them. So I don't know if you're able to give us a detailed list of concerns that you have that we can convey to our state representatives and state senator.
Absolutely. We'll definitely follow up on that. We've been working hard on those particular bills, but other things on the agenda as well, and really appreciate your support in that effort. Yeah, I totally agree. It needs to be easy to vote. It also needs to be hard to cheat, and I think we can accomplish both.
Anyone else? If not, thank you, Justin.
Thank you, guys. Appreciate it.
We have 5 more reports, so Marcy, I'm going to wait 5 minutes, okay? We're going to take a 5-minute break.
Guess we're waiting.
Joe's right here.
Those are mine.
We're waiting for Frank.
Maybe if I just
Okay.
keep us moving quicker. And this moves it forward.
Oh, Doug too.
And Doug.
Oh, yeah.
It's all right. We waited for you, Frank. You know, we didn't want to start without you.
You can blame Doug.
All right. Marcy, take it away.
Sounds good. Well, I'm all set. So Commissioner Garcia, you can ask all the questions that you have of me.
Hey, yes. Hey, come on now.
First off, thank you for having me today. I really appreciate it. I noticed I was sandwiched between 3 elected officials, so I asked the sheriff maybe he could order dinner for you gentlemen tonight. We're gonna be here a while.
Thank you.
So, I'll go through mine pretty quickly and leave time at the end for questions that you might have. Just kind of to go over the human resources staff. So we've had one addition to our group. That's Michaela Moore. She came to us the first day that basically the state shut down. And we keep saying to her, don't worry, once COVID's over, you'll see how the office really runs. Well, it's been over a year and she still has no idea what that's going to look like. So feel free to stop over and welcome her, but she has already been here for a full year. So if we move forward, one of the biggest impacts that we spent quite a bit of time on, like everybody else, was the COVID-19 impacts. We had to quickly transition to create new pay codes for the emergency leave acts that were implemented. So we did a very quick shift to make sure we were getting our employees paid correctly for those leaves. Lots of changes to payroll because of that. So created new codes. We managed over 286 leaves due to COVID. So our staff was on the phone pretty frequently over the last year, working with employees, whether it was their child's school was shut down or close contact, all of those things. And then also working through how would we get that employee paid? What type of pay types would they have? Were they eligible for pay? So worked through that. Some things that are to note are that we quickly worked with Pine Rest to get EAP sessions lined up for our employees through COVID. And we saw that our numbers increased significantly during that period of time to provide that support to our employees. We quickly transitioned to having over 50% of our workforce working from home. And that is making sure we were working with supervisors, managers, and leaders to work through getting not only equipment at home, but getting forms filled out so that we were aware who was at home, where people were at, getting COVID surveys up and running so that we could monitor every day. And then just as we look at the EAP programs, we had 558 people go through those EAP trainings. So I think that's just a significant number that shows that we're providing resources to our employees as we went through it. One of the areas that we moved pretty quickly to was talent development. All of our courses, typically most of our courses, were offered in person. Sarah Allen, our trainer, was doing those in person, doing course content, teaching Spanish, and had to quickly transition that to an online platform. And one of the things that we learned really quickly is Ottawa County employees love to learn. So some of our numbers for this year, for 2020, were 54% of our employees attended development opportunities. We had 183 different courses offered. We quickly transitioned to moving on to Knowledge City. So it was basically an online training system that we also incorporated because we knew as people were going home, there would be some downtimes and we wanted to make sure we were educating our employees at the same time. So this just kind of walks through all the courses that were completed through Knowledge City. We had over 1,000 courses completed by our employees. And we were also able to quickly transition the COVID safety measure e-learnings to an online platform so that no matter where our employees were working at, they could take that course. As far as employment, that also changed a big focus because we, as we started through COVID, We slowed down on hiring just slightly, but then we picked up once we realized that not a whole lot was going to change. And we took all of our hiring and moved it to online Zoom interviews. So just a whole different way of interviewing employees, putting them in waiting rooms, and we conducted 979 interviews. We were moving forward with the Higher Reach pilot program. We still are. It's one of those pilots that due to COVID is still a pilot, but we are using the Higher Reach methodology in our hiring too, and it's just not moving forward quite as quickly right now based on COVID and some of the transitions. Position changes, we had 64, we had 28 people retire last year, and just food for thought. So Tacey's doing payroll, and she processed 631 different changes in, whether it's changes in pay, changes in department, new employees. So just a lot of different sets of paperwork going on in 2020. If we move forward to employee relations and payroll, we successfully negotiated all 7 collective bargaining agreements during the pandemic. Again, moved to an online system where we were negotiating via Zoom. So a change that worked pretty well. Our disciplines were definitely down in 2020, but again, most of this is just due to the pandemic. If we move forward to the employee assistance program, this is one area where we saw a 15% increase in 2020. We saw that our employees were reaching out for more resources, and we were very lucky to have EAP as our Pine Rest as our EAP partner. Bob Vanderpool, who runs that program, also did 11 department briefings with our departments. That's if something happens and he comes in specifically, a lot of the times it's with the sheriff's office. He'll come in and do a debriefing with them. And then listed below, we've got some of the titles and trainings that both Bob and Ron Scott from EAP provided in 2020. If we move forward into benefits and workers' comp, one of the areas to note is that we are still promoting our high deductible health plan. This plan saves the county money, saves our employees money, and allows us to have the best health insurance around. If you look at any of our counterparts, Kent County, Allegan County, our health insurance plan is just a sales point for our employees when we're doing recruiting. And currently we have 97% of our employees on that plan. We've got numbers on there, work comp numbers. So all of that stuff was still taking place just at different levels in 2020. So trying to do comparisons is just very difficult based on the nature of the work that we were performing. We've got statistics on our Empower retirement. We moved fully to Empower administering our 457 accounts. We did that. We started in 2019 and made the full transition to 2020. So that saved our employees money on percentage rates when they were investing their money. And currently we see over 55% of our employees contributing to that account. That's really good because we also have that account on top of our MERS plan. As we move forward, a few of the things that we started in 2020, we're still working on. We're still working on the wage study results. The board approved moving forward with a wage study last year, and we are going to finish that up this summer. So we're working on that diligently. We have moved to Munis 2019. So that's transitioning our payroll system over. And then we also are doing a full payroll replacement that we were working on in 2020 and moving forward to this year. So we're hoping that that will be implemented this summer also. And we also added a Roth 457 for our employees. I think as we look back over 2020, obviously we all want to move forward to 2021 and get everything behind us. But I think the biggest thing that I want to say is As we look at our employees, I want to thank the Board of Commissioners for entrusting us. You've entrusted us as leaders to make hard decisions for employees as we move forward. We talk to employees every day on all ranges of COVID, and sometimes we don't have or know the right answers right away, but as a leadership team, we've all come together to make the best choices for our employees, and our employees are doing a great job. I mean, we've got half of them still working from home, and we still see huge levels of productivity across all of our departments. So I just really want to thank you for your support, and I'm open to any questions, and I think I kept that
You did very
far
well,
shorter
Marcy.
than Justin.
Yep.
I know it was after me though, so good luck.
He's going to be even shorter yet.
To you guys.
Who has questions for Marcy? Anyone? So Marcy, the recognition dinner that we didn't
Yes.
have last year.
We did not have the recognition dinner.
Yes.
We did still recognize all of our employees on their milestones. So we did still send out the gifts, letters to them, and let them all know that hopefully we can do a recognition dinner in 2021. So this year, it's still very much day by day what that will look like. But our hope is that we will have the 2021 recognition dinner and have basically twice the size, because we intend to have everybody from last year be there. And
Good. That was going to be my
2-year
question.
bash.
Yeah, you're going to have everyone there from 2020. That's good.
So we're going to need a large location this year.
Yes, I know.
So we'll start working on that this summer.
I
but
know
that
such a
takes
place too. Thank you.
I would assume that.
All right. Any other questions? If not, thank you, Marcy.
Thank you.
Okay. Ottawa County Water Resources Annual Report. Mr. Bush, you're up.
How are you doing, everyone?
Very good.
All right. Well, again, commissioners, I want to say thank you for having me here and giving you my annual report from 2020. We all heard the challenges, especially in our department. So I just want to highlight all the important things going on with me. It's an honor to also be your Water Resources Commissioner in Ottawa County, but I am the one in my 3rd year as the president of the Michigan Association of County Drain Commissioners, which is another honor. Our association has been very strong on changing drain code, making amendments, and then working with my colleagues across the state. It's an honor to be a part of leadership, again, not just in Ottawa County, but to also be the president of our association. Again, going into my 3rd term. Usually it's a 2-year term, but they wanted me to stay another year with the COVID situation and go into 21-22 year, still being the president. So again, I just want to make that known that I appreciate that. And again, I appreciate your support on my department and me through 2020. And again, this is my 8th report, and last year was very challenging. So I'll go ahead and start by going into the top 5 things that I, as your elected official, as a Water Resources Commissioner, is focusing on: water quality, flood control. And that's because of the growth in Ottawa County. We saw the census report and how we're moving up. We passed Ingham County. What that means is it makes my department and myself for development reviews very busy. As you saw the plat board reviews that were signed by Justin, they also get signed by us and the board. So most of the board who are on that plat board sees that, and the road commission. So we've been very busy. The other one is cost benefit analysis on every drain project we do, whether it's petition or just drain maintenance. I take that as one of my top priorities and the top 5 to make sure that the cost analysis benefit what I'm doing is working for the constituents of Ottawa County. The other one is protect our natural resources. We have a lot of wetlands and a lot of other habitat invasive things going on. We want to protect what we have in Ottawa County. That's why people want to move here and live here and raise their kids here and also work here and enjoy what we have. So I want to protect that to the best of my ability, and that's what I'm elected to do. And also inform and educate people on what my job is and what my department is and what the county is here to provide a service for. So we take that very strongly and customer service very seriously. So as I go into the challenges, 2 of them that were very crucial to my department were my chief deputy, halfway through 2020, went back to his previous employment, which I was very supportive of. He made a good move. And also my development coordinator, as we're developing Ottawa County, and not having that person in that role made my job very difficult and more busier on top of all the flooding issues. But I wanted to introduce Josiah. I don't know if everybody else has met him, but he is my new chief deputy that HR helped me recruit from. Oh yeah, Karen's back there. Yep. She came from Karen's office. So thank you, Karen. But he's working out very well. And I just wanted to introduce Joe, the other Joe. His name is Josiah, but everybody calls him Joe. So I just want to make sure that he's helped me tremendously get caught back up from where we left off, get through the 2020. He got hired in November, and he's working out very well. So I want to appreciate him and appreciate my staff. Again, some of the things that we were dealing with were the record lake levels. Everybody knew about it. It was on TV all the time. Houses falling in, lakeshore erosion, and I had to deal with a lot of that. On top of inland lakes flooding, drains overflowing, and I'll get into some pictures later and talk about that. But it was one thing after another. And then and put COVID in there. Half of the staff was working from home. I didn't want staff going out in the field. And in order to do a lot of these things, we were challenged. You had to go in the field and see it and try to take care of it. And that's what I took that responsibility as myself. Didn't want to put my staff in jeopardy with what we didn't know going on out there, and took it on myself to go meet people, keep social distance, keep masks, but at least go out and provide that service as an elected official to meet people. So I take pride in that we kept things moving and kept the train on the tracks, but it was very, very complicated. Again, I talk about the significant spring flooding, and I got pictures later that also not just the rain events, but groundwater, which contributed from the Lake Michigan and all around. We're surrounded by water all the way around in Michigan. And at one time, Michigan was kind of underwater, just a big wetland. So it's definitely, we went backwards when it comes to flooding. Just to highlight some of we had new developments, 55. When I say 55, we're like, well, that's kind of down from last year. And I'll show a chart in a minute. What that means is, don't look at the 55, it's the size of developments. And if you drive around, go in Jamestown, Georgetown, Holland Township, Allendale, there's houses popping up everywhere. Even with the price of lumber, even with the price of land, it's not slowing down anytime soon. It's full steam ahead. And, we review the developments for every township and almost every city. So I see those firsthand, and they get to me almost prior to going to the planning commissions at the township level. So when I say 55, that number might be low, but a lot of those were subdivisions, which are either 1 to 2 to 12 phases. So it's amazing when you look at 55 development reviews during 2020. The other one, we have 1,336 soil erosion permits, which that's a lot of soil erosion permits for a COVID year with a situation that people were still motivated to build and to expand. And then we had 647 inspection reports, which is quite a bit considering, again, 2020. Development reviews, I just want to kind of hit on that. If you look at, it looks like 2020 is down, but it was the size of the developments. So when you look at 17, how high we were, nearly 120 that year. I go back 15 years, so that's a good trend if you look at those trends. Again, 2017, it was a lot of, again, some subdivisions. When you look at these developments, it takes 2 to 3 years to develop a piece of property. So it's not like a 1 year 2020. It's like, okay, they probably started in 2017 and they're starting to build houses in 2020. So this kind of a 3-year trend when you start the process for planning commissions to get the approvals through me, and then go back to get the final approval through the townships, get building permits. It's usually a 2 to 3 year process. So when you look at 2020, it looks like we went down, but the size of the request was larger than that. Soil erosion permits, kind of the same thing. And if you look at, again, we went from 19 to 2020. And if you look at the green, you can see the size of the soil erosion permits. That's because the homes are being built in those subdivisions that require a soil erosion permit. So the request was there. Drain work vendors, I kind of just wanted to highlight the top 10 on each. If you look at the top 10 contractors by bid volume, a lot of those are local folks. We try to keep it local, and the West Michigan area. And then the top 10 consultants, and a lot of those they either have an office around Grand Rapids or near us. But again, I just wanted to highlight those top 10 for you reading the report. Drain maintenance inspections. If you look at the amount of inspections, we go back to 2016. And then if you know, in a 5-year comparison, the drain maintenance expenses, we spent quite a bit of money, even with COVID. We had our second highest year in 5 years, which that tells you the request was there. And I'll get into a second why the request was, you know, we kind of forget that now. You go outside and look and it's like, wait a minute, we don't have flooding. There's no water issues right now, which is surprising. First time since I've been elected, I'm not staying up all night trying to figure out what to do with water. Now I got to figure out how am I going to make it rain, because the complaints we're getting, because all the work we did last year to get rid of water, now they're saying I cleaned too much. Now there's not enough water. So in 2020, these are just kind of the bigger drain petitions that we were petitioned. I'll highlight the Corey Bishop, Sand Creek, the Werber, Crockery Lake. We had 43 petitions in 2020. I just highlighted these because these were the most biggest ones and the most costly ones. So the one I want to highlight is Sand Creek. It was an $860,000 petition project, but I had a $600,000 grant to pay for majority of that project. That worked out very well. Before that, a couple years ago, I got another grant for Sand Creek for $280,000, and that was for the planning to get the grant for the 600. So really it was like an $860,000 grant total between the planning and the actual project. So, and then the other ones you can tell they were quite expensive. The Werber drain was 1.8 million. That was completely funded 100% through large assessments to the DDA of Grand Haven Township and the city of Grand Haven. Between the both, they paid for that project 100%. So that's the kind of collaboration that we try to do with our municipalities. This is a bunch of numbers that can get really confusing. I don't want to, the highlighted one I want to talk about is the total expenditures, which is the last one on your right, on the bottom, which is $4.8 million is the amount that we spent for drain maintenance, which is quite large. And that was all due to constituents' requests, the flooding. It was just drains. That's how important drain infrastructure is to Ottawa County, to people, because we did have a lot of flooding. And then this is the 2020 borrowing and assessments. If anybody ever wants to come down and share or have concerns or talk about it, because it gets really, really confusing, you can ask Josiah anytime. I would say the drain code and how we do drains, I know Karen could probably agree that it's the most complicated accounting there is, because we have Munis through the county, we have drain ledger through our department, and they have to match. For special assessments, the way the treasurer gets them in the townships and how they're all through Munis, it gets very complicated. For your sake of time, I don't want to get into it right now, but here is the report. Again, if you have any questions, I'm more than happy to share those answers with you. And then here's another 2020 assessment roll breakdown on, the top 5% of assessments, the county is, I put in there 4.45%. But if you look at Park Township individuals, they were 15.09% of 2020 assessments. But I just wanted to highlight the top 5%. So again, if you have any questions, be sure to ask me. The 2020 conclusions, we talk about the lake levels. And then we had 23 new petitions received. Again, it says in 2020, but they were really 43 because we had 15 active, and then we had some more come in. And then again, filling in the positions of my development coordinator and chief deputy was a challenge. We're also going to be continuing to collaborate with my colleagues, the townships, and then every department in this county building and beyond, because again, we can't get through it without everybody's teamwork, which we have a great team in Ottawa, and our departments are great. Everybody's just, we try to get the job done the most efficient way we can. And then 2021 projections, again, lake levels are about a foot lower than they were last year, which is a plus, until you get back into, you go about 5 miles inland, and then you're starting to see a decrease in some lakes, personal lakes. Again, groundwater is going down. When I say groundwater, it's the shallow aquifer. as well as a deep aquifer, as we know. But there's a shallow aquifer that's starting to see issues now because we haven't had any rain. The snow melt was minimal. And without the rain that we usually get, it's definitely having an impact in Ottawa. COVID-19 is, it's continuing and it's unpredictable, as we've been hearing. And we'll see how that plays out with our department. And again, drain code revisions and updates. One thing that we're doing is we updated the development standards in Ottawa County. So the developers had to change what they're doing. And that's because of the Federal Clean Water Act. So from 1972, every 5 years there's a cycle. It's called the MS4 permit. And I had to reissue that through the state. I got my permit. Now that's requiring me to update my standards. And pretty soon, in the next few weeks, you'll probably see a resolution to pass those standards. And they're in collaboration with Allegan. A couple years ago, I just back up a few minutes. A couple years ago, or a few years, I should say, seems like minutes. A few years ago, I collaborated with the City of Holland, County of Allegan, County of Kent, Muskegon, and then Ottawa. We all pitched in and tried to do similar development standards so we're not too far apart. We each have our challenges. We each are different soil types. We each have different groundwater issues. But again, we wanted to be consistent. So I did update those standards, but I do need the board's approval for the state rules. And it's a mandate from the state to do that. So I will be asking the board to pass that. But and we're going by those standards right now. And I can get in detail later on what that consists of. But every developer is operating through that. I know I see Doug periodically on the Home Builders Association meetings and updates. And so we're trying to work with the developers and builders to make sure that we can navigate through the new standards. And it's working out pretty well. I gave a lot of educational Zooms, had a lot of meetings about it, and give updates and working again with their engineering firms to navigate it. And it's working out pretty well. So again, if you have any questions on that, be sure to reach out. Here's the one particular chart that I really want to highlight because I had so many flooding issues in Spring Lake, Grand Haven Township, Park Township, everything on the west side, Allendale to the west. And if you look at this, I had a study done through Lakeshore Environmental. And I said, you know what, guys, I don't know what kind of project to do. You can engineer the world out of this thing, but you can't fight Mother Nature and lake levels and groundwater and precipitation. So we went back on a 40-year annual model. Lakeshore Environmental has monitoring wells all on the west coast of Ottawa County. So I said, hey, you guys got monitoring wells up in North Ottawa Dunes? And he's like, yep, this is Kurt Kella, if you guys know Lakeshore Environmental at all. And I said, hey, I need some data. I don't want to model anything. I need hard facts data. So they put this chart together, and it's a 40-year annual you can see the highlighted areas that speaks for itself. But you can see Lake Michigan on those levels and look at 2020. It's basically, it matches about 1984. And then if you look at the precipitation, look what it did at the same time when we're having high lake levels. And then if you look at the groundwater, it was the highest it's ever been. So with those three things in Ottawa County, I'm just speaking for Ottawa County, and preferably I can use it as a model for, I would say, most of Ottawa County, but especially from like Allendale to the Lakeshore. This is why we had all the issues. And you can, like I said, you can engineer and design a lot of things, but is it going to work? But when you have a chart like that, that makes it very challenging. This is why a lot of people had flooding issues. This is why a lot of backyards had standing water in it. It had nowhere to go. It literally, we talked about this at my last annual update a year ago. And here we are this year trying to figure out where all the water go. Lake levels are going down. People in Spring Lake and Lake Mac are happy because they're seeing their docks again and seeing some beach. But then now we're seeing the trend of not having water inland because it's draining out through the Grand River and other channels that we dredged on other drains and making its way out to Lake Michigan. And we haven't had no precipitation. But I wanted to highlight that's a lot of the reasons that made my department very, very busy and made me in the field every day trying to figure out solutions for people that you can't really find one. Here's a couple examples. The one on the upper left is out in Nunica that really never had a flooding problem before in 30 years. You look at that truck, they're actually emptying their house because they had about a foot of water in their house. The truck is, you can see it backing up to the steps. They were moving out. They were abandoning their house and staying in a hotel. We had nowhere to go with that water. At that time, I've had emergency managers out there. We've had fire departments. I mean, we were trying to figure out where to go with water, where to pump it. Everywhere around us was high groundwater. The whole bit of everybody had water. And then if you look at the upper or lower right-hand corner, that was in apartment complexes down in between City of Ferrysburg and Spring Lake Township. And there was water running in from the outside parking lot, and you see a hose sticking out the window. They had pumps in the kitchen pumping water back out, and they put sandbags trying to block the water from coming in. We and Coast Guard Park, so I know Roger knows this area very well, and that whole Coast Guard Park was flooded. This whole area was flooded, and I had nowhere to go with water. I had pumps on standby. I was pumping in a lot of areas, but when you get to the point like this, there's nowhere to go with water. Here's a couple other areas. One on the left is in Alice Street. That's by Commissioner Al's place. Behind Alice Street, you can see a trampoline in the back. That water was pretty high. Again, the water had nowhere to go. It was backing up from Lake Mac, and it was all the way going in the city of Zeeland under Chicago Drive. I mean, it was just stagnant. It was flowing, but it really was slow and didn't have anywhere to go. The other one is on a wind direction last year. If you remember, Ottawa Beach Road would close periodically because if the right wind direction, it would blow water. And one of our judges lives around the corner for here, and he called me and he's like, can you come and help me with this? I got to pump water on my basement. I'm like, there's nowhere to go with water. Lake Mac was actually flowing over the people's yards and going into the streets along Ottawa Beach Road. So that's just an example of, again, it was kind of a crazy year in 2020. And here's the other issues I talked about, lakeshore erosion. Those pictures don't show justice, really what was happening. I think Phil Kyers has been out to a few of those homes, maybe a few other people, but the amount of beach that we've lost in the last couple of years was amazing. Last year was just phenomenal. People were losing 75 to 100 feet of beach, and the houses were, a couple of them had to get demolished, and a lot of people were moving their houses back. So again, just a part of our department was involved in. And then here's a couple more pictures, and these are kind of unique because if you see the walls, the seawalls were way out there and they're underwater, and that used to be land where they're at now, and it's nothing. It's kind of like a beach. So the beach was gone. Here's a project on Sand Creek I just wanted to show, and this one had real severe erosion. This is kind of, we're fixing it. Just kind of give you an idea of, well, what does it look like when you're out there in Sand Creek? Well, this picture here shows that we're trying to fix one of the meanders that got blown out. If you look just further to the, I guess, end of the picture, further downstream, there's a blowout on that end too. So we kind of fix it, and here's what it looks like afterwards on that section. And they do section at a time, just to give you an idea of what a drain looks like. And again, I just want to quickly go through these organizations that really helped me out through 2020, and they help me out every year, but 2020 especially because of farmers. A lot of farmers couldn't get fields planted. This year they're already planting, and it's not even Memorial Weekend yet. So Farm Bureau, the MAC has been wonderful. Home Builders Association, that group has been awesome to work with, again, through the new development standards. The NRCS, the Conservation District, again, Parks, MDOT, the Road Commission and I work hand in hand. Someday I love to share with you guys what Brett Laughlin and I do together to save taxpayers money and use our staffs and just trying to work together. Townships, villages, and again, cities, the collaboration that we have is second to none. There's a lot of people who are jealous throughout the state that our relationship with our elected officials and our departments and the collaboration we have is just, there's a lot of people that are jealous. They love to have what we have. So I don't take it for granted. We're blessed. State representatives and our Senator Victory, its relationship has been really well. And then MDARD, and then Community High Point Bank is one of our financial institutes that we use for drains. But again, it's almost 4 o'clock, so I know Kemper's got to come yet. So that's all I have. If commissioners, you have any questions for me, again, at any time, you're more than welcome to contact me. I'm happy to meet with you. And I know Frank and I have had conversations about a constituent issue, and we worked it out, and I showed him past records we were involved a couple of years ago. And so if you ever have any constituents that are kind of barking at you, be sure to tell them to bark up the right tree and bark up to Joe. It's my job to make sure I handle those situations. So not you guys. Again.
Any questions for Joe? Joe, I really appreciate the work that you've done over the years on the lake boards. And I think every one of those members have always appreciated it as well. So thank you very much for the work
Yep.
that you do.
Well, I'm happy to serve. And again, thank you, board, for all your support. Thank you.
Thanks. Al, you want to leave it forward?
Yeah, I'll just slide out.
Okay, all right. Slide out this way, would you?
Okay, thank you very much.
All right. Next up is Heath White, probation supervisor of the 20th Circuit Court Probation and Parole 2020 annual report. And I've seen him, and it looks like he's on one of the Caribbean islands, but I don't think he is. But
No, I'm up here in Michilimackinac with the bridge behind me.
okay, all right.
This is my obviously it's not real, but anyways, I want to thank the Board of Commissioners for working with us, providing us office space. I'm going to be real short so I can give Steve a lot of time to complete his report. But we do have 3 offices we're utilizing in Ottawa County, one in Holland on James Street, at the courthouse in Grand Haven, then a Hudsonville office at the 58th District Court. We are still, with the state of Michigan, we are still working remotely from our offices. It sounds like we might be able to go back in a couple of weeks from what I've heard. But my agents have adapted well during this time. Most of my agents, so I should say all of my agents, are out in the field, seeing their people, their probationers, their parolees, doing oral drug tests out in the field, doing tether hookups, GPS hookups, out in the field or sometimes in the parking lot at the office, at either of the courthouses or in Holland. I want to thank Steve Kempker, Val, Captain Christensen at the Ottawa County Jail for working with us during these difficult times. We've had to modify a lot of what we do differently than the way we used to do business. For violations, we're not always arresting people. We're utilizing more of our tether equipment, our technology that we have at our hands. Currently, we've seen some numbers decline. We are currently supervising approximately 650 offenders within Ottawa County, which is down from 800 offenders from last year. We've seen a reduction in our pre-sentence investigation reports. For those who aren't familiar with the PSI report, it is the sentencing report we submit to the judges, the defense attorney, and the prosecutor at the time of sentencing. Last year, let me look at my numbers. We had 775 reports we completed in 2019. This year, we're down to 493 reports submitted. A lot of it has to do with the COVID, obviously. A lot of cases had to be adjourned and or delayed until they can get people somewhat back to normal back at the courthouse. Like I said before, we are continuing to drug test in the field. We're seeing, again, as it was last year. Last year we did 10,000 administered cases, which done the traditional way of urine testing in the office. Now the agents are handling on their own out in the field with oral testing. So we dropped from 10,000 tests that we normally would do to 4,000 tests. But we've seen 278 positive tests, where last year we had 303. So we've been a little more smart with our drug testing, not drug testing everyone across the board. We're looking at more risks, higher risk of substance abuse, history, current behavior. So our positive tests we've been seeing have been steady. Even though we've reduced the number of tests, and we still continue to see methamphetamines as our primarily issue within Ottawa County, where 76% of our positive drug screens have been meth, the second highest being cocaine at 43% positive tests. again, we've had some new additions and some to Ottawa County. We recently hired a Denise Tyler, who is an agent from Kent County. She came in to take the place of, well, I should go back and say we had 2 retirees this past year. Longtime agent in the Grand Haven office, Steve Garwin, retired back in December. And then longtime adult drug treatment court agent Kim Cummings retired back in February. So with the loss of Kim, my GPS agent, James Wilson, moved into Kim's role as the adult drug treatment court agent. And then we hired Denise Tyler from Kent County to fill in Jim's role as the GPS agent for Ottawa County. Again, we're hoping we can get back in the office in a couple of weeks, but I think we've learned a lot on how we can do business differently. A lot of my agents are able to utilize Google Duo or FaceTime to see people for their reports, which I think is a good thing, especially if they don't have to come into the office to report in person. If they can do it on their lunch break or a break time from their office, instead of, if we don't have to interfere with their work, but they're not at high risk for substance abuse, we don't need to drug test them, let them stay where they're at home or in their office. So I think with the department, we're seeing different ways how to do things, regards to agents working remotely from home. I don't know if this will be an ongoing thing or we adjust the way things permanently, the way they are. A lot of things are up in the air right now. Is how we're doing business, but like I said, we're adapting well, and I want to commend my agents for adapting appropriately. And again, I want to thank everyone for working with us during this challenging time. I'd like to open it up for any questions people have at this time.
Thanks, Heath. Any questions? Yes, Mr.
Yeah,
Kyers.
Commissioner Kyers, on some of the new laws with cannabis, does that affect how you test some of these people and how
Yeah, we've really reduced the amount we're going to test for THC since it's become legal. Now that's not to say if we feel someone has a significant problem with it, we'll still have that condition for drug testing to test for cannabis. If it's interfering with their daily lives, their daily routines, not getting up to go to work, they're high on the job, they're getting, it's interfering with their daily life. Yes, we'll test for that and then we'll address accordingly with appropriate treatment.
Thank you.
So,
Anyone else? If not, thank you, Heath.
thanks again. I want to thank you all and hope to see you back in the office soon.
All right, thanks. All right, next up is our sheriff. Been patiently, I think I woke him up. Jump?
Justin, if you can start that PowerPoint, there's 129 slides from the annual report.
No,
that we can go through.
We cut almost 100 of them out.
Getting text messages if I'm buying dinner and catering in lunch for you or dinner tonight. So, well, again, it's good to be back to give you our annual report. And Mr. Chair, Mr. Vice Chair, members of the board, and Mr. County Administrator. Today is just really a quick snapshot. As you know, this report is very detailed, a lot of numbers through it with all the contracting we do and the services that we provide, and all the township numbers are all in there. And that includes our general road patrol funded. So again, it's my pleasure and honor to present to you the 2020 annual report. You've been provided today with a short summary, and then I believe the full report was in your board packet. And as we speak right now, the annual report is being posted on our website and is also being sent out to all of our partnerships, townships, cities, villages throughout the county today. So again, the Sheriff's Office primary mission is to provide a safe and secure environment in Ottawa County. We do that by preserving public order, reduce crime, provide safe and secure environments in our communities by the enforcement of state and local laws. As I've said to you many times before, victims of crime continue to be our top priority. We continue to provide excellent and quality law enforcement services to our citizens and to our visitors in Ottawa County. It is our goal to identify, understand, and address issues in our communities. And as you can about imagine, during the past year and a half, we've had issues that there were no playbooks written for or policy and procedures written for. We accomplish this through collaborative efforts, problem solving, working closely with our citizens, community partnerships, and many other organizations in Ottawa County. And some of these organizations have actually reached out to us. We've been meeting with them. I know some of the commissioners are involved in some of these organizations. I just had the opportunity about 2.5 weeks ago to meet with some of the Hispanic community leaders down in Holland, and just a great interaction and great positive comments out of that. So again, as the COVID hopefully starts to dwindle, more and more of the in-person meetings, especially for law enforcement, I think is important to develop that relationship with our community members. Members of the Sheriff's Office, all of our staff work through professionalism, respect, integrity, dedication, excellence, equality, and diversity statement. And we follow our core values and our vision that was laid out almost just over 4 years ago when I took office. 2020 has been a challenging year for all in the global pandemic, community tensions, and uncertainty. A year that brought many challenges and changes to law enforcement. During the COVID pandemic, the Ottawa County Sheriff's Office has been able to maintain and deliver its quality law enforcement services, thanks to the support from many of our dedicated staff serving each day as they perform their duties. And I have to say this much, the members of the Sheriff's Office that are out on the road, that are in the corrections unit, that are in our records unit, we didn't skip a beat. And the undersheriff and I are extremely proud of this group as to what they've been facing during this past year and almost year and a half with the COVID and many other issues. Like I said, some of the things that have happened to law enforcement in our world. Well, just to touch on a few things, I'd like to start in the area of the index crimes. Violent crimes, which includes the murder, criminal sexual conduct, robbery, and aggravated assault, we're up about 1%, and property crimes were down about 1% in 2020. In 2020, we investigated 3 homicides, which was down from the year before. Again, all 3 of these homicides have been solved, and the suspects are currently involved in the judicial system in Ottawa County. And again, in these homicide cases, there was a victim to offender relationship. So they were not random acts against an unknown suspect and victim. Aggravated assaults were up in 2020. Several of these cases, again, being very violent assaults and very complex investigations. I do have to credit, again, our staff. We are dealing with more violent situations. As you heard me say to you a few weeks ago, we're seeing more and more weapons and guns. This is concerning to both myself as the sheriff, but also for the safety of our citizens and for the safety of our staff that's out there dealing with these situations. So we are currently working on plans and working with some of our partnerships to start dealing with more and more of these situations. In our category of non-index crimes, there was about almost a 6% decrease in 2020. And when we look at it, much of it was due to the COVID. Calls for overall service across the county totaled 66,078, and that was down from 73,402. What we noticed during the peak months of the onset of COVID, the months of March, April, and May, saw decreases in the calls for service. But again, as summer came around And as of today, we're back to our normal call status that we were pre-COVID. So again, there was that decrease in the calls for service. Incidents overall were down, but serious crime accounted for a higher percentage of our calls. We saw a slight increase in fraud cases. Family offenses were down, but assault and aggravated assaults in these family offenses, domestic assault, we saw an uptick. For arrest in Ottawa County, there were a total of 5,901 arrests. That includes both adult and juvenile. Adult arrests and juvenile arrests were slightly down compared to 2019. 2020, deputies made over 24,000 traffic contacts and issued right around 16,000 tickets. 5,753 traffic crashes were investigated, and that's down 23%. That's a significant amount. And again, some of that plays into COVID. We investigated 13 fatal traffic crashes with a total of 14 lives that were lost. That is a 35% decrease from 2019. And a side note here, statewide during COVID, elsewhere in the state, their fatal numbers rose. Ours went down. And again, I credit that to our community. I credit that to our traffic enforcement unit that we have. Again, they didn't skip a beat during the COVID. Out of the fatals, 3 of these crashes involved alcohol and or drugs, which was a little bit lower from the year before. In our corrections division, there were just about 4,103 admits into the county jail. That was down quite a bit from the year before, which was at about 6,898. And one thing that you'll hear us terming now, when we refer to inmates in the jail, they're not referred to inmates anymore. They're referred to as citizens, because that's what they are. They're a citizen in our jail facility. So we've kind of slowly working. Every now and then you will hear us slip a little bit and say inmate, because for the last 38 years of my career, that's what we've called them. But we've come to realize in today's world and working and the staff that we have over there, that those inmates are citizens. Again, we continue to work with the courts, several of the diversion programs that we offer. Again, hoping for success with the programs for the GED, substance abuse, Forgotten Man Ministries, career development programs, classes for mothers and fathers. And as you know, I had a very tough decision to make, and we eliminated the SWAT program. Well, we've kind of moved that into the SWAT program in-house within the jail facility. And for the couple of the commissioners that went through the jail the other day, and Mr. Finsky, I believe it may have been you that mentioned to me, you cannot believe how shiny the floors were in that jail facility. That jail is the best looking. It looks like it was practically built not even a year ago. And I have to credit our staff, the citizens that are housed in that facility that are working these details. They're painting, they're waxing floors, they're keeping the place spotless. So with that program, they still build their time, good time, to get their sentence reduced. It's also been a huge cost savings to the county. We don't have to contract out that painting or that cleaning. In our investigations unit, the Detective Bureau, they continue to stay busy. Again, as I mentioned, they worked 3 major homicide cases last year. They worked some extremely complex cases, everything from fraud to other assaults, criminal sexual conduct cases. Our cold case team continues to work and follow up all investigative leads. They are currently working 3 active cases of unidentified persons. Some of you probably had saw that we exhumed a body last year in efforts to try to get DNA sampling from that body. And then the other couple, we have some body parts recovered along Lake Michigan. Again, trying to identify those through DNA. We also have 2 of our detectives are currently assigned to 2 federal task force, which are kind of on a part-time basis. One is assigned with the IRS dealing with fraud investigations, and the other assigned to the FBI on human trafficking task force here in West Michigan. And when I say human trafficking, it is present here in West Michigan. Our WEMET team, our drug team, is our multi-jurisdictional drug team. They remain busy combating the illegal drug activity in Ottawa County. Again, they are still seeing some of the harder narcotics. Marijuana has kind of dropped to the bottom of things right now. They still work very few cases involving marijuana, but again, meth and heroin, some of those cases, as you heard from the WEMET report, have been on the rise. Also, just as a side note, I continue to represent the Michigan Sheriffs on the executive board of the Michigan HIDA, which is through the President's Office of National Drug Control and Policy. We oversee the HIDA stands for high intensity drug areas, traffic areas, and we oversee the funding and operations for intelligence gathering and the drug teams throughout the state of Michigan. The Sheriff's Office still maintains 2 detectives, primarily assigned to the Children's Advocacy Center. In 2020, these detectives investigated 815 criminal sexual conduct and abuse cases against children, with 293 referrals to the center. There was a decrease in activity at the center during COVID. And I sit on the board for the CAC, and we were worried when we saw that because we knew that the children were not back in school, they were not out at other activities, and we knew that that number was probably going to start shooting back up once COVID started to relax a little bit, children got back into school, and we were right. I talked to the director the other day. The cases are going back up. The forensic interviews are going back up. And again, as the children got back into school and the education and the chance for reporting is what brought that numbers back up. So again, the CAC Center will be busy into the future. But again, still alarming numbers at 815 involving children. We still have our computer forensics detectives. They handled 208 investigations involving digital media, and they did about 380 forensic examinations of digital devices. We continue to find just about in every crime, somehow there's digital media tied to it, whether it's computers, tablets, cell phones. And again, it's amazing the information that is gleaned out of those to help us in those investigations. The Sheriff's Office continues to see many concerns in Ottawa County. Domestic violence and crimes against children continue to rise. Also a concern, again, is the mental health incidents. This is almost a daily call for us, whether it's morning, afternoon, or night. Our road patrol and correctional staff are dealing with mental health incidents daily. The Sheriff's Office works in collaboration with the county mental health, community groups, with the courts looking at diversion programs, which is extremely important. And I have continued to remain on the governor's mental health diversion council, where we are continually looking at the mental health issues around the state and how they are affecting society and the criminal justice and correctional system. Also an offshoot of the governor's diversion council, I'm currently working on a subcommittee with MCOs, which is the licensing group for law enforcement. And we are looking at a complete revamp of the mental health training for law enforcement and other entities. We're looking at carrying this out from law enforcement to fire, to dispatchers, everybody involved in that public safety realm. I was also recently appointed to the Committee for 988, a crisis helpline for our citizens in Michigan. This will be a statewide helpline, and we hope to have this up and running by July of 2022. Also, just to touch, our Marine unit is alive and well. We just completed training with them. They will be launching onto the waters here soon. Mr. Bush said the good news is the water levels are down a little bit, but we still are concerned that we will have issues like we did last year. I was just informed yesterday that the Department of Natural Resources has awarded the Sheriff's Office a grant for $67,000 to provide for extra patrols in the high water areas for slow no wake enforcement to prevent damage along our lake shores. So again, most of our issues are up in the Spring Lake area along the Grand River and some down in Lake Macatawa. So again, that $67,000 is a good boost for the Marine Division to get out and do some education and enforcement if necessary in our waters. And hopefully, again, we've been working with community members throughout the winter that have expressed concerns about this coming summer. So the Sheriff's Office will continue to provide professional law enforcement services delivered with customer service in mind, fair and impartial policing, and understanding equality and diversity. We will continue to make victims of crime our top priority. We will continue to maintain safe and secure and professional correctional facility, staff, and services. We look ahead to the future as the growth in the county continues, and we look and assess our needs now and into the future. So the future. Continued change will take place at the Sheriff's Office. Change, as we know, is inevitable in our profession, and it will occur whether we like it or not. As law enforcement professionals, we will continue to look at ourselves and take steps to improve our level of service and advance our profession. Great accomplishments have been made over the past year. Our new policy and procedures are about 99% complete. We should have that wrapped up. Those policy and procedures bring us in line with federal, state, and best practices. We recently also are going to take that step forward with our body camera and in-car camera project. And we are also going to work on becoming an accredited agency, which will be a task, but we can do it. Accreditation is the progressive and time-proven way of helping law enforcement agencies calculate and improve their overall performances. Again, the foundation of accreditation lies in the voluntary adoption of standards containing a clear statement of professional objectives. Obtaining accreditation status represents a significant professional achievement. Accreditation acknowledges the implementation of written directives, policies, and procedures that are conceptually sound and operationally impactful. The Sheriff's Office is also participating in the National FBI Use of Force Data Collection Program. And I'm proud to say that all 83 sheriffs in the state of Michigan participate in this program. Many states across the country, there is not 100% compliance. We recently received our credentialing from the U.S. Department of Justice for safe policing under the presidential order, and we'll be expanding our training within the agency and much more in the future. Community policing still has proven to be the valuable tool and the backbone of our agency and plays a vital role in our law enforcement efforts. We collaborate with our communities, local leaders, business leaders, school districts, courts, faith-based organizations, and many others to identify areas of needs and develop and deploy effective strategies to address those needs. To hear in closing. Thank the citizens of Ottawa County. During the last year and a half, I have a folder in my office. There's no negative in it. I was just overwhelmed after the George Floyd incident, the COVID, the response from the people in this community, the support. I also want to thank you, the county board. We have the best sheriff's office in the state of Michigan because of you, because of our county administrator. The help from Mr. Vanesson is greatly appreciated. Also, I have to thank Mr. Shea and the other departments. Karen, you're the diehard that stuck out for me. Everybody else left. So thank you. No, working with fiscal and HR, they play a vital role in our day-to-day operations. As you know, we're going through a lot of retirements. We're going through a lot of hiring. And the undersheriff told me the other day that since we took office, we've hired just about 100 people. So it's ongoing. We are finding good quality people to hire. We have people coming from other agencies. We've thankfully supported the pilot program for the sponsorship that we hope is going to be very successful. We have those recruits in the academy right now. I also need to thank the men and women of the Ottawa County Sheriff's Office who serve in this noble profession and serve our citizens and visitors in Ottawa County. Again, the Sheriff's Office staff, I could not do it without them. My Undersheriff Valerie Weiss for her professional leadership and her professional partnership as the two of us oversee and lead this organization. I could not do it without her. My executive team for their day-to-day dedication, the lieutenants and the captains. You talking about a dedicated group of people. I can call upon them at any time. And we work together as a team. Just because I have the title of sheriff doesn't mean I'm always right or we're always going to do it this way. We use the team approach. And again, with that executive team, I can't say enough about them. And again, the undersheriff, rock solid, and just really helps guide the leadership and sometimes guides me in the right direction too. It's a really good partnership and team that we have. So again, it makes us the best organization in this state. I also have to throw some kudos out to our state representatives, Senator Victory, for their constant support, Congressman Huizenga. These people are willing to pick up the phone and make a phone call to myself and sometimes our other staff asking questions. I get calls right from the floor sometimes. So again, their support has been overwhelming. So again, I encourage you to read through the annual report. Recognize again that this is just a snapshot of so many accomplishments and again, making positive differences in our community. Again, I can assure you the men and women of the Ottawa County Sheriff's Office take pride and are dedicated to providing excellent quality and professional law enforcement and correctional services to our citizens and visitors. And again, protecting our quality of life, because that's what really makes Ottawa County here. That safe and secure environment to live in, work in, and visit. So again, I can't thank you enough for the time, and I can open it up to any questions. If you don't have any today, but you come up with some later, please feel free to reach out to me right away. Again, that report's a snapshot. There's a lot of information in there. But again, I think it shows overall, you know, we're not sitting around. We're busy. And again, those calls for service have risen back up to the levels of pre-COVID. And again, our goal is to continue to provide that great service here.
Any questions? If you do have questions afterwards, like Steve said, send them an email or give them a call.
Yes, yeah, feel free to reach out at any time. And again, your support's been great. And
Thanks,
keep
Steve.
moving forward. Thank you.
Quarter update, is that? Quarter update, yes. Is that Karen?
No, that's me.
That's you?
And I don't see those here. So we'll do that next meeting.
That's great. That is great. Great news.
Actually, I can cover that Thursday morning because it's just an update on the strategic plan.
Okay.
So,
Report of the county administrator.
I have a couple notes I wanted to go through. No, actually, we'll be meeting again Thursday. We did get some guidance finally on the ARP funding. And so we're digging through that. Karen and her staff primarily, but also John and I are also kind of working on that. As you know, we're putting a team together to advise the board. And then, so anyways, that's all coming. And that's all.
Okay. All right. General information, comments, meetings attended, anyone?
Yeah, Mr. Chair.
Yes. go
Yeah,
ahead.
today we had a number of parents speaking about, their desire to see the restrictions lifted. And I think, we all, have different feelings about that maybe. But, the state of Michigan has talked about how we get to that point, what we all want to get to. And that means hitting certain vaccination numbers. I think the health department was here talking about, what they've done and their work communicating the importance of vaccine for public health and for, how we move to that restrictionless life. But I guess I'd also like to talk about what we can do to help folks get vaccinated and, what incentives we can offer. I think Darrell pointed out that, there are folks who would like to get vaccinated, but for work or for family reasons, have found getting vaccinated difficult. So I guess if we can offer incentives to help folks get vaccinated, I personally think we should do that and discuss, what steps we could take.
Okay, anything else?
Mr. Chairman?
Yes.
And I'll be real brief. And I'd like to leave today on a positive note if I could. Yesterday, I had the opportunity to address the fifth grade students at Allendale Christian School. Earlier this year, they read a book on kindness. They picked out 20, 25, 30 people, sent out letters to them of what kindness meant to, what they learned about kindness, what it meant to them, and how we could share kindness to other people. And it was an amazing, I had an amazing hour with them, but reading the letters from them was amazing. I kept these letters for a month and a half now, and they're with me all the time. And they're kind of a pick me up, when we have people on your throat all the time mad about something. Everybody seems mad about whatever right now. So it was encouraging to see a group of young people. We're in good shape here, I think. A group of young people who are concerned about where we're going and kindness and sharing kindness. So I had a chance to talk to them about that and some county issues yesterday. Made a little fun with them, and it was a very positive experience.
Anyone else? If not, public comment. This is the second time. Anyone from the public? Is there anyone on Zoom?
No, sir.
Is there anyone in here that would like to? I don't see any public anymore. Okay, I'll entertain a motion to adjourn.
So moved. Support.
Moved to support. All in favor, say aye.
Aye.
Opposed, same sign. Thank you. We're adjourned.